Good afternoon. Welcome to the May 12th Governance and Priorities Committee meeting. I'd like to first recognize that we're on the traditional territory of the Snuneymuxw First Nation. Our clerk today is Ms. Sheila Gurry. We have the following councillors attending electronically. Maybe not. We've got nobody online. Today's Governance and Priorities Committee meeting will be held in accordance with the Community Charter and Council Procedure Bylaw 2018, number 7272. If during the meeting any member of the gallery has a question on a matter that was considered by the committee today, please sign up on the sheet located on the table by the double doors to my left. Please note that the Council Procedure Bylaw states questions will only be taken on staff reports and other business items. Before we start this meeting, I'd like to take a few moments to remind those who are attending in person about the rules of decorum for all council and committee meetings. A meeting of council and a committee is intended to be a place where democracy can freely take place in a respectful and safe manner, and the council chambers is a workplace, so we will be following procedures to maintain that type of decorum. The first item on the agenda is the introduction of the late items. Agenda item 6A, Basic Needs Overview Presentation 3, add Sheila Gurry, the additions to the agenda.
Thank you, Chair, and good afternoon, Council. For late items, we have the addition of a PowerPoint presentation titled BC Housing Update, Nanaimo Homelessness and Housing for item 6A. We also have an update to Jennifer Fox's presentation title to Regional Director, Vancouver Island Region. We have the addition of presenters Amanda Lemon, Director, Addiction, Medicine, and Substance Use from Island Health, and Brody Tapp, Manager, Addictions and Substance Use, Island Health, for agenda item 6A1 as well. And that's it, Chair.
Thank you. Could we get a motion for the adoption of the agenda as amended? Moved by Councillor Manley, seconded by Councillor Perino. All in favor? Agenda adopted. Now we get a motion for the adoption of the minutes as circulated. Moved by Councillor Armstrong, seconded by Councillor Hemmons. All in favor? Motion carried. Agenda planning. Upcoming topics and initiatives. Ms. Gurry.
Thank you, and good afternoon again, Chair and Council. For upcoming GPC topics and initiatives, it is on page 7 and 8 of your agenda package, and it lists the upcoming topics for the next several GPC meetings up until October 27th. The next meeting is June 23rd, and we did manage to move the controlling sale of invasive species up to that GPC meeting, as well as we'll have urban tree canopy management strategy and development cost charge and amenity cost charge bylaw review for that next meeting. July 14th and October 27th are also noted on the upcoming topics and initiatives page. And Councillor Gusserbrock, I believe you have an upcoming topic that you wish to possibly add to maybe the November 24th or December 8th meeting. We could look at scheduling it closer to the date, but I think you have a topic you wish to add.
Thanks. Yeah, just carrying on the conversation around building permit review times, and so I sent a motion out to council that I can read it out that I'd like to move. That staff provide an update report in Q4 2025 on the implementation of the Alan Nielsen building permit function review recommendations, including an evaluation of the success of the implemented recommendations, the timelines achieved for permit issuance across permit types, and identification of any recommendations not yet successfully implemented, along with the steps required to pursue them. Okay. Speak to it. Yeah, we had. No,
it's just for an upcoming topic and agenda item. So if it would be preferable to have it as a motion, though, if someone wished to second it, and then we could add it to the agenda.
Councillor Eastman seconded.
Thank you.
I'll just speak to it. You know, this is an ongoing area of focus for the city that we've done work on, and that report that Alan Nielsen gave us with the recommendations on how to improve the building permit function was in March 22nd, 2021, and some good work has been done on that, and I think it's an appropriate time for a review of that and see what the next steps are to continue moving the dial. Seeing no other questions or discussion, okay. All in favor? Opposed? Motion carried. That brings us on to the next item, reports under Healthy Nanaimo, Basic Needs Service Review, and it'll be introduced by Mr. LaBerge, our Director of Public Safety.
Thank you, Chair, and good afternoon, Council. So this afternoon's presentation will be providing you with an overview of the basic needs and services available for people experiencing homelessness in Nanaimo. Services provided both by the city and by our community partners. This report has been prepared in response to the direction you gave at the November 4th, 2024 meeting. It's quite timely as the preliminary results of the 2024 point in time count confirm that homelessness is rising as it has in previous counts, most recently up to 621 from 515 in 2023. With that, we know that 70% of the people that are living on the streets have no access to daytime or overnight shelters. Actually, the best estimates put actual homeless numbers around 1,000 in Nanaimo. So this afternoon, you'll be provided with an overview of current meal programs, hygiene services, overnight and emergency shelter services, health services, daytime services, including the new drop-in hub. And we're also going to be introducing you to a new social services management mapping project, which has been developed with the support of our city IT team, in particular Mr. Mark Willoughby and Carrie Ing. I must say that they put this as a priority in front of a long list of other projects they're working on, which we're very grateful. This tool will assist with the analysis of relationships between the placement of services in the community and potential impacts on neighborhood safety and vitality. Before I turn it over to Ms. Wood, I'd just like to introduce and thank our community partners who are here today who will be speaking to you about their perspectives on homelessness in Nanaimo and the services and basic needs that they are providing. And we have everybody up at the podium. Just briefly, we have from Nanaimo First Nation, Marina Wife, the Chief Community Health Officer. From BC Housing, Elson Dunnett, who's Executive Director and Strategic Advisor on Homelessness, with Jennifer Fox, Regional Director of the Vancouver Island Region, and Jerry Michael, who's the Coordinated Access and Assessment Manager. From Island Health, we have Lisa Murphy, Director of Mental Health and Substance Use Clinical Operations, and with her is Amanda Lemon, Director of Addiction Medicine and Substance Use, Brody Tapp, Manager of Addiction Medicine and Substance Use, and Mike Kirby, who's the Manager of Mental Health and Substance Use. From Vancouver Island Regional Library, Eileen Gillette, Director of Public Services and Planning, and Nanaimo Systems Planning Organization, John McCormick, the Executive Director. In the gallery, we also have from the United Way, Sydney Madden, Director of Government Relations, and Naomi Fields, Reach and Home Specialist. So again, thank you very much to all community partners who took time this afternoon. And with that, I'll turn it over to Ms. Wood. Thank you.
Thank you, Mr. LaBerge.
Thank you, Mr. LaBerge. So as Ms. LaBerge mentioned, today's presentation will start with just a brief overview of the basic needs services that are available in Nanaimo before turning it over to our partners for further discussion. And just a big thank you to our partners for taking the time today to have this important discussion with us. It's very appreciated. So as noted in the report, city staff do want to recognize that this report is not fully comprehensive. We know that there's other volunteer groups, there's individuals that are providing food, clothing, other basic needs services to people who are down on their luck, to people who are vulnerable populations within Nanaimo. But we were only able to really focus on the ones that are provided at a fixed location, that are low barrier, and that are really dedicated to folks who are experiencing homelessness. In addition, you'll notice also that in the report, there's not all the outreach services that are in there, and that's just due to the complexity and the variability of the programming that they offer. So for instance, our CMHA Street Reach team, or even the work that our CSOs do, we haven't included them in the report, but just for everybody's information, their role is very, very vital to the work that we do, and they connect people to services who aren't able to otherwise access locations as well. And finally, I know the committee is aware of this and many of the people in the gallery, but for folks who maybe are watching at home, I think it's important just to remind everyone a little bit about the local factors of homelessness in Nanaimo. So as Ms. LaBerge said, we are experiencing an increase in both visibility and the complexity of people experiencing homelessness. And the preliminary numbers from the 2024 point-in-time count led by Snuneymuxw First Nations with community partners estimates that we're closer to approximately 621 people experiencing homelessness, with nearly 70% of them being unsheltered. And as Mr. LaBerge said as well, sector professionals will say that over the course of the year, we're looking at about 800 to 1,000 people experiencing homelessness. And this growing need is really compounded by the loss of key services. So we've, in the last 10 years, lost some very important basic need services within our community. We've lost a drop-in center, we've lost some meal provision, we've lost other shower programs in the past. Our out shop, we've lost a lot of those services and programs. And basic needs, as you know, are foundational to support and stability and wellness, and they're often the first point of contact for long-term services. So just to start with meal provision, so you'll see all the locations up there as well. So we have 6 organizations that are currently providing a range of dedicated emergency meal services to individuals who are unsheltered or precariously housed. As you can see, there are a limited number of indoor drop-in meal options available, and most meals are distributed outdoors through outreach or at various other program locations throughout the community, and funding for these programs is limited. So usually they're coming from private donations or volunteers or community grants. The 710 Breakfast Club's closure in 2021 and the closure of the Salvation Army Dining Hall at the New Hope Center created a very big gap in daily indoor meal services, and historically the city has provided bridge funding for that meal provision until other funding sources could be made available. But as you know, no permanent funding source exists for this essential service. Nevertheless, our agencies are very creative to offer that limited meal service through outreach supported by private donations. The next one is the hygiene services. As illustrated on the map, and due to the ongoing lack of shower and hygiene facilities in this community, the city continues to fund the only shower program for unsheltered or precariously housed individuals at Caledonia Park. And the Caledonia Park program, previously operated by the Unitarian, now operated by Nanaimo Family Life Association, reports that there's been almost a 400 increase of shower usage since 2018, since the city's been funding it there. The Leisure Economic Access Pass, or the LEAP Pass, that the committee will be aware of has been expanded to allow some organizations serving people experiencing homelessness to assist in that adjudication process, which has helped to complement the shower program. So through the program, individuals can access recreational facilities, which means they can also have a shower while they're there as well. So providing access to the LEAP program helps, but options remain really limited, especially for those who are substance affected and cannot manage in a general facility. The city also maintains a network of public washrooms and drinking water throughout the community, and these facilities are often, what we hear through our CSOs, the only point of access of sanitation for people experiencing homelessness. And finally, the OPS, just up until last year, started offering portable washroom services for people who are using the overdose prevention site, and that's available from 11 a.m. to 9 p.m. So daytime services. So as this committee is fully aware, in recent years, the city has been partnering with a variety of different agencies to provide warming center services during the winter month, really trying to supplement our role in the emergency response during extreme cold weather. And we know that these warming centers have acted as essential lifelines, offering food, clothing, and safe spaces during the coldest months. And we know that after the warming centers close, downtown service providers report a sharp increase in a need for basic need services. And often unsheltered individuals have nowhere to go and often relocate to doorways or businesses, playgrounds, or parks because of a lack of daytime alternatives. And in the absence of purpose-built or drop-in warming centers, facilities such as our own recreation lobbies and public libraries have been used increasingly, despite not being designed to support individuals with that high level of acuity. So these locations are also shown on the map here above. In partnership with the federally funded Reaching Home program and CAB members, the city is partnering to fund a drop-in hub currently operated by Island Crisis Care Society, and the hub offers access to basic needs services such as food, hygiene, supplies, and clothing, and other social and health connections. And between January 2nd and March 31st, the hub has recorded 6,170 visits. It has welcomed at least 156 first-time hub visitors between that time period and provided overnight shelter to 106 different unique individuals. A full review of the hub's operations will be presented to Mayor and Council in early summer for your information. BC Housing is also using the hub as an access point for the province's Heart and Hearth programs as well, linking unsheltered people to supports in temporary housing. And additionally, BC Housing is also funding the 20 temporary overnight shelter beds at the hub, which is operated by Nanaimo Family Life Association. And that funding is temporary. However, we're really grateful for BC Housing to be able to extend that until May 31st, 2025. This slide is the emergency shelters. So Nanaimo has 63 year-round BC Housing funded emergency shelters for adults. There are 8 beds designated for youth under a different ministry funding model. So when looking at the number of individuals enumerated, as I mentioned in the 2024 homeless point in time count for comparison, Nanaimo has shelter capacity for approximately 10% of its need compared to other communities that we often look to for comparison of similar size. So for example, Kelowna with 89% shelter capacity and 67% in Kamloops. For the 2024 and 2025 past winter season, BC Housing also provided an additional 84 seasonal emergency shelter beds and funded an extreme weather response shelter at Harvest Church in partnership with 710 and the Nanaimo SPO. So this map before the committee only illustrates the shelters that are currently in operation as of May 1st, 2025. And you'll see from the report as well that service providers have stepped up with funding internally their own beds as well. Sorry. Oh, it's so good. So for instance, Nanaimo Family Life has 2 emergency shelter beds that they're internally funding. Salvation Army also has 10 beds that they're internally funding as well. And they do report that they've been working closely with BC Housing to expand their capacity throughout their shelters. And for the committee's information, the report contains the average occupancy rate as reported by service providers for the calendar year 2024. And the next slide shows the supportive housing. So the committee is fully aware that the city's been working with BC Housing on a number of supportive and affordable housing projects through the 2019 MOU. So 4 of the 6 sites are identified as part of the MOU that are providing permanent supportive housing specifically for this population that we're talking about, so for people experiencing homelessness or at risk of homelessness. And these sites will provide approximately 187 units. In addition, the City of Nanaimo was identified as a priority community for the Heart and Hearth program, and their provincial programs designed to address homelessness in encampments through coordinated outreach and rapid housing. And BC Housing staff have been working hard to implement 4 sites in Nanaimo to provide approximately 237 temporary hearth units. And the city's been actively supporting the supportive housing projects through the provision of land, capital contribution, and lease supports depending on the project. So far there are 329 permanent and temporary supportive units currently providing housing for this population, with approximately 342 more proposed. And I just want to say, please note that at the time of writing the report, the city staff did not include the proposed 50 of the permanent supportive housing at 1030 Old Victoria Road, just because we didn't have a number confirmation at that time. And so that's why this number's been updated for the verbal presentation. But you'll hear a lot more from BC Housing later about that as well. In addition, for this map as well, I just want to point out for clarity that the future supportive housing sites that are identified on this map don't differentiate between temporary and permanent at this time. So if you look at 1030 Old Victoria Road site again as an example, you'll see 2 future supportive housing icons. One is actually referring to the temporary hearth site, and the other one is the permanent. So they're not both permanent. One is temporary, one is permanent. And for health services, really pleased to have our health partners here today, and you'll see in the report all the different services that are being provided to the complex needs of individuals living unsheltered. So we have low barrier services such as general medical care, mental health support, substance use services, harm reduction, addiction support, and detox are being provided. And finally, I just want to introduce the Social Service Management Mapping Project. So really pleased to say that the Public Safety and GIS IT departments are working on a new data tool that will help the city to analyze and identify service gaps or underserved areas which can support the strategic placement of essential new services, including basic needs services. The tool also analyzed the relationship between the social services and neighborhood vitality. And some of the key elements, they're in your report, but some of the examples include social service locations, such as the services we're talking about today, positive activity generators, so it could be parks, community centers, urban centers or transportation networks, and overlaying contextual data. So we could include things like population, vacant buildings, public safety calls for service, and other socioeconomic indicators. So just as a preliminary example, these maps presented here demonstrate the layering possibility with this tool and taking a closer look at the downtown core only, starting with meal services. And then we can add layers as we kind of go along. So if you look here, this one is the meals. Then we have the hygiene services, daytime services, the emergency shelters, supportive housing, and then the health services. And just so you know, the user experience will be much improved when you're using it digitally. It's hard to kind of do a snapshot of the different maps, but you'll be able to click on an icon and you'll be able to see the drop down and you'll see what services are being provided there, maybe if there's occupancy capacity or different other details that might be interesting about that service. If the committee has questions, Mr. Mark Willoughby and Mr. Kerry Ng from the GIS IT departments are here. And I do want to let you know that at this point, we're just approaching this tool as an internal tool for us to be able to, look at placement and just look at analysis at this point. But there is capability to expand it as well. So, community partners such as Snuneymuxw First Nations, BC Housing, Island Health, the Vancouver Island Regional Library, United Way, and the SPO, and so many others are really essential to this work, and they've been invited today to share their current activities, data, and perspectives on these 3 questions. What's working well in addressing homelessness and meeting the basic needs of unsheltered individuals? What additional supports are urgently needed? And how can we collectively improve access to essential services for those most in need? And as mentioned by Mr. LaBerge, we do have representatives here from United Way. They're not on the presentation list, but if there are questions about United Way or Reaching Home or any activities of the CAB, they would be delighted to come up and answer those questions as well. And just thank you, and I look forward to the questions and the discussion ahead. And if there's no questions for me, okay, before I turn it over.
It's my first rotation at this job today.
It was on. Okay, good.
Councilor Perino.
Thank you, through you, Chair, to Ms. Wood. Under health services, there used to be a van that went around to deal with our vulnerable community members who might have wound that need to be attended, wounds that need to be addressed and so forth. Is that still going on? I just didn't see it on the list.
Yeah, through the chair, they are listed in the summary. So, and Island Health can probably speak to this, but that's their primary care outreach.
Yes.
And then they have a core outreach as well, but they do the wound care that you're mentioning.
That's right.
They're included in the list because they do have fixed locations as well as some of the mobile services.
Okay,
that
great, great.
Yeah.
I'm pleased to hear that. Thank you. Thank you, Chair.
Thank you. Councilor Manley.
Thanks. I have a couple of questions. One is about the LEAP programs. What is the uptake on the LEAP program? How many passes have been given out, and who's giving out the passes?
Yeah, through the chair to Councillor Manley. So I'd have to come back with a full report with our Parks, Recreation and Culture partners. But there have been a couple of, they've been kind of, trialing it as a pilot. And so they started out with a couple of different agencies. The last one that they just uploaded to be kind of an adjudicator was the Nanaimo Family Life Association. And so we've had some initial setup and conversation with them, but be happy to come back to the committee to provide you with some other details, maybe with an update with the shower program, and then maybe we can give an update around the different LEAP passes that are being distributed through these organizations.
Okay, thanks. And then my second question is, Mike. Now I'm back. Right on. Thank you, sir. And this might have been a figure that came from the United Way and Reaching Home, but I've seen numbers that say that there's 6,000 people that are precariously housed in this community. Is that something that comes out of the point in time count, or is that just something like related to, it might have been a provincial number, because you've given us some provincial numbers before about who's living in poverty in the community, who's precariously housed. Is that a figure that stands up for you? around 6,000?
Yeah, through the chair. So that number, I believe, first came through our Health and Housing Action Plan as the number of people precariously housed. And I know the SPO has been working on updating those numbers, so that could be maybe something that John could touch on when he gets there. But that was through the Health and Housing Action Plan, initial numbers around the precariously housed people.
Okay. Yeah, I mean, it's an interesting number to know, because when we see the point in time count increase by almost 100 people, and just knowing how many people are precariously housed in this community, and the lack of affordable housing, and the influx of people moving to the community based on this has become a destination, and almost been discovered that we're kind of at the tip of the iceberg, and we need to do a lot of work in terms of making sure that people have affordable homes in this community that are covenanted and protected as affordable homes. Thanks.
Thank you, Councillor Manley. Councillor Armstrong.
Thank you. Are we tracking how much money the city's spending on this, such as land purchases, staff, shelters, all of that?
Sorry, through the chair. You mean how much money the city is spending on all that? So we have been tracking that. I know we all within our own departments track, and we've had some initial conversations, even some requests from from the provincial government at looking, at what the city's doing around supporting this population and the funds that we've been spending it. I think that there's just a little bit of a deeper dive that probably needs to go into a little bit further detail, especially around some, how do we measure how much time RCMP is kind of also contributing to this, because the city is also funding that. So a little bit more detail on there could be done.
Yeah, the reason I ask that is we see some cities now, and I'll use Richmond as an example, that are refusing to purchase lands, et cetera, and then the province is stepping up to do it. So I think as the dollars start to dwindle, I'd like to be able to say, listen, the city's invested this much, we deserve more dollars to help us because we are playing ball, not like some other communities. So I just think it's important that we track it so that we can show we do have a commitment, and I think our commitment here is larger than a lot of other communities per capita. Thank you.
Great, thank you, Councillor Armstrong. I'm not seeing any other questions, so yeah, I think we'll do the presentations, and then after each presentation, ask questions on it. Ms. White, welcome.
Go ahead.
Oh, thank you. Learning a thing or two. Thank you, Christy. And thank you, Mayor and Council, for allowing us to be here to present on, hopefully, what I want us to all remember is that despite the homelessness, that at the end of the day, all this collaboration and all the funding we get, that we use it to the maximum benefit to benefit the most vulnerable, marginalized people in Nanaimo. And so I'll just start. So what is working well in addressing homelessness to meet the basic needs of unsheltered individuals in Nanaimo? So Nanaimo is fortunate to receive United Way funding, and it's funding for all of the Indigenous population in Nanaimo. However, the last Q3 report, I didn't finish the Q4 report yet, but 379 were Indigenous that we served. 654 were non-Indigenous. So even though we have Indigenous funding, our workers aren't going to walk by and say, oh, you're not Indigenous, so I'm going to keep on going. Like, that doesn't happen. And also, each Tuesday, there is a hot meal served to the homeless in Nanaimo. And there's a barbecue or there's pizza. There's a hot meal served to anybody that shows up, and they usually go to by the right across from Thrifty's there. And they set up, they also take down, and there is no garbage left, and they don't allow people to cause a kerfuffle. So they keep control of the audience that's there. And also, a lot of people get fed. They get fed a hot meal. And so that's usually about, when there's hot dogs and hamburgers in the summertime, like up to 150 to 180 served per afternoon. So that's quite a lot. In the wintertime, it's about up to 90 people each Tuesday that there's a hot meal served. 3 other days of the week, there's like little packages of hygiene, snacks, ensure. So really, so the population that's provide the basic needs, because really we're looking at the unsheltered population, but also there's a lot of people I didn't know until we did the pit count, how many people live in their cars. And you know what, I must say, what is working is the CSOs that you hire at the city. Those CSOs, like I have seen them when I've been at a restaurant on Gabriel's Cafe. And I go there for meetings like every 6 weeks, and there's the CSOs helping the homeless move along. They're helping them get up. And sometimes a cab's called if they have too much stuff. So, but also the CSOs also support the outreach that we have at Shenandoah. So if there's messages that needed to be given to the homeless that our outreach are working with, then, you know, so I really need you to know the value, but also the cultural safety and trauma-informed that most of these CSOs have. I've never heard a complaint yet. Additional supports or services that are needed to address homelessness. I think the additional supports that are really needed is the addictions and mental health. And, you know, I look at the 12 transitional units that Shenandoah has that the city provided us with, and the wraparound services that we have that go with that building. I think that's what's missing, and that's what we need, especially given the complexity. Like I heard Christy talk about the complexity of people's mental health, and you look at it and they are complex. They're not like 10 years ago. They're not like our homeless people 10 years ago. You go drive up and you look at by the Sunset Square building there, and you see the people in. So I you know, the services that's really needed, and you know, I really appreciate Lisa Murphy. She takes the time to come and meet with us to say, hey, how can we work together? How can we work together? And that's what it really is going to take, is all of us working together to address the homelessness in Nanaimo. And how can we access basic needs services, housing, healthcare, be improved? I think, first of all, you know, really having that wraparound support. I think collaboration of all the partners, a true collaboration where, you know, our number one priority should be how do we house people, the affordability of rent, and you know, people that are going without hydro or they're without work. We will help those people. We will help those people because we provide services to the entire population of Indigenous people in Nanaimo. So different things like that are working and they're needed. And I think also what would work is, I know sometimes when our homeless outreach go out, there's been some pushback in parts of the city where they're like, you can't park there, when really all they're trying to do is provide a service to the homeless. So we are working with Christy and her team to figure out where can we park. They're not going to be there for a whole long time. And I must say that our homeless outreach for Shenandoah, one thing I'm proud of, and that's the land issue. Whenever they go out, they also bring garbage bags. Because, you know, even though they're the homeless, we still have etiquette, and you want the land to be left in a good way, so because you want the land to be here forever. So I think parking for them when they're delivering their supplies, in supplies they deliver tents, they deliver shoes, they deliver boots in the winter, they deliver umbrellas, they deliver clothing, whatever is medication, wound care. If somebody is really struggling, they sometimes will bring them to our health center to have wound care. And we had one young man who probably could have had his leg amputated. They brought him up and he was seen by our nurses and our physician, and he didn't have his leg amputated. I believe he was hospitalized for a while, but those types of things. So it really takes a collaborative effort, and you really should be proud of the work that Christy does and Rosalie and her team, because that working with the city and the partners is really, we're making a difference. A small difference, but we're making a difference. And that's what's important, because how do we end homelessness is by all working together. We put all of our money, despite the staff, all of our money that we get from the United Way goes directly to supplies and or housing, shelter, basic needs for the homeless. So I don't know if I have anything else that I wanted to share, but the pit count, one thing that I learned was that some of the homeless don't want to be identified. A lot of the Indigenous homeless, the regulars that showed up for the barbecue, not one of them showed up at the pit count. And so I was like, why is that? We don't know why, but how do we do the next pit count? How do we make sure that all of our Indigenous and or any homeless person is counted? And so I watched as I observed, because we were a part of the pit count. What I noticed was that some people, it's out of fear. Like if you're running from domestic violence or another situation where there's fear, you're not going to want to be counted. So, thinking about all those, because we have great ideas, but I think unless we really work with our homeless and meet them where they're at, we're never going to make a difference. We're never going to make a difference. So how do we work with them? And, I think our success that we have had is in Shinanema, is we hired one of our own pure-lived outreach workers, and he is remarkable. And I just came from a meeting with the chief before I came here, and he was like, I'm really proud of the person that we hired. He's pure-lived, and I think he's going on 3 years clean and sober, and now he's giving back to the homeless in Nanaimo. So, in couch surfers, like, how do we address the couch surfers, and how do we address people that are living in overcrowded homes and situations? There's so much to think about, and you're right, Paul. There's a lack of affordability in housing. And so, and then the state of mental health and addictions, a lot of the work that our outreach do is detox treatment referrals. And not just, doing it and then walking away. I see them taking them the full way, getting you to detox. If you don't have a phone to get to detox, we'll get you a phone. If you lose your phone, we're going to get you another phone. If you want detox, we want to get you there. If you want to be on the housing list, you need a phone, so we need to help you get there also. And what else would work? I think for there to be stepping stones where there's, you're coming off the street and then you're sheltered, and then what's the transition to that? And then what's the next transition? So I think for me, that's my vision that I see, that I'm hearing. And so, I'm not afraid to go out and give to the homeless. I'm not afraid to stop and say, hey, you know, I see a young lady and she's standing there and I'll say, hey, do you need an umbrella? Do you need a tarp or do you need something? So, you know, it's just taking that extra step and making it meaningful and authentic and working together. And I think, you know, looking at the complexity, and another thing that is really helpful for the work that I'm doing is a Car 54. That is the most genius thing this city has ever done. Like, the Car 54 has really helped us with some of our people that are really struggling with mental health and addictions, but more the mental health piece. So, you know, that's about all I have. So if you have any questions, now's your time.
Thank you so much. A few questions here. Councillor Armstrong, is that just carryover? You got a question? Okay, yep, go ahead.
Thanks, Ms. White. Since KL has been delegated, have you noticed for Off Reserve, for the interurban, have you noticed they're having more success in connecting youth to things that prior to their delegation? Or would you know that, or was that something for Bill?
For some, yes, and for others, no. And so that actually became a topic in the pit count. There's a few really young youth, and so how do we support them? And these are kids that they've had an impact while they've been in care. And so they have trust issues. And so what we're trying to do is look at what is our next step. So actually, I just came from a meeting with KL, and, you know, we're looking at how we're going to revamp and add to a positive wraparound services for our children and youth.
Yeah, that's something that's really lacking. And I mean, the problem I have is, you know, doing my time as policing, you have like 25 to 30 minutes when somebody says they want help to get them that help, or they could change their mind. So we need readily available detox and treatment for when somebody's ready. Especially saw that for some of the girls working on the street. I went off the street, well, within 2 hours, still hadn't found a place, I'm done, goodbye. You know, so I think it's really important that, you know, government step up to the plate and start building these, because you're right. You know, I never even knew what the term concurrent medical disorder was until like 2006, and now I bet you just about half the people we deal with, that's what they've got, so.
Yeah.
Very good points, thank you.
Thank you.
Thanks. Councillor Perino.
Thank you, Chair, and a question through you. Ms. White, first, just thank you so much for being here, and thank you for the work that you do for the Indigenous members that are just so desperately in need, so thank you, I appreciate that. When you talked about the parking for the outreach team, that to me has got to be the easiest fix on the planet. So I'm just wondering, Ms. Wood, can we not get their team members who are going out to have a particular sign that they can put on their vehicle to say outreach worker? I mean, to me, you need to have a place to park to be able to get to people to, I just, that one shocks me. Of all the problems, that one is so easy. I'm just wondering why we're not doing more to fix that one.
Through the chair to Councillor Perino. So we have been working with the outreach team to really try to figure out where folks are at and where they need the access to the outreach service. So a lot of times they're outside of the overdose prevention site, connecting with folks there as well. They're down at One Port Drive where they do the barbecues, but now, you know, folks are going there as well. I think the challenge is that they're spread throughout the city, and so it's really trying to figure out, they don't have cell phones, so it's a lot of word of mouth that folks are doing, and so it's that consistent kind of approach of delivering the outreach services but also connecting with the neighborhood and trying to figure out how everything can kind of roll out together.
So if we could, through you, if we could have a system where we know, Ms. White, when you're going to be sending outreach teams out, then we can maybe get them parking passes that they need. Just a thought. It just drives me crazy when it's such a simple problem. I'll leave it with you. It's way higher than my pay scale. Thank you so much. Thank you.
Thank you. Councillor Hemmons.
Thank you, Chair, and thank you, Councillor Perino, for that question, and Ms. Woods for the nuanced response to it. My question, Ms. White, thank you so much for being here. You noted that a lot of your outreach work is devoted to referring people into detox, and I'm curious, this might be a question for Ms. Murphy and follow on Councillor Armstrong's question. What is the time between we refer someone and they have service? And how do we take care of them in that interim?
The time frame, I think it depends. Sometimes it's not as long a wait as other times. We have had Lisa actually answered the call, and we've done some work with Clearview Detox. And so I think it's improved. We do need to do better though. And with FNHA, First Nations Health Authority, what the Coast Salish have proposed is to have a Coast Salish detox center. Because there's not let's just face it, we're in a toxic drug overdose crisis. And it's not that Clearview doesn't want to take the clients that we have. There's no room. Yeah. There's no room. And so I know it's on the table with First Nations Health Authority and the 20 nations on this island, and they did put a motion forward. So my hope is that one day we add to that detox list, because you can't refer to Victoria, because then we're competing with Victoria in their toxic drug overdose crisis. So it's really, you got to stay in Nanaimo and wait for a bed here at Clearview, and or refer to a treatment that has detox beds as a part of their treatment. So, you know, and that's something that we're looking at in I think for me, when I hear the outreach team that works at Nanaimo, the work that they do, and the relationships that they have built, actually not just with Lisa, but Lisa has, I don't know where I think they're the core outreach team. They are an incredible team with Island Health. And so, you know, that's why all these services are so important to wrap around. And the length of time, though, is quite long. And the reason is that there's just not enough detox beds. There's not enough. And it's not that nobody's doing anything wrong per se. It's that there's a competition for those beds, and we're in line like everyone else. So that's the fairest answer you're going to get.
Thank you. I really appreciate that. Thanks, Chair.
Thank you, Councillor Hemmons. Not seeing any other questions. Thank you so much, and I'm sure there'll be more questions as we move through.
Thank you.
Our next presenter is Alison Dunnett, Executive Director and Strategic Advisor for Homelessness, and I'm not sure is...
It's actually me.
Okay.
Councillor, yeah.
Jennifer Fox, Regional Director, Vancouver Island Region. Thank you.
Thank you. Good afternoon, everybody. Thank you for the opportunity to be here for this very important conversation. My name is Jennifer Fox. I'm the Regional Director for Vancouver Island Region BC Housing, and I'm the lead for operations for BC Housing. I'm joined today by my colleagues, Jerry Michael, who is our lead for coordinated access and assessment in our region, and Alison Dunnett, who is our provincial lead for homelessness programs. And so we'll work our way through this presentation together and hopefully answer your questions as well. In terms of topics that we'll share with you today is the provincial approach to housing and homelessness, and that will be Alison, as well as supporting people and communities. And Jerry and I will walk through the supportive housing in Nanaimo and the shelters, which Christy has already done a great job about sharing and presenting. Alison?
Afternoon, Mayor and Council.
I've got a little bit of a frog in my throat, so apologies for that. As Jen said, I am Alison Dunn at the ED for homelessness at BC Housing. I come today very thankful to get to spend time in Nanaimo, but also with partners like Christy and John from the SPO, who we've been working with over the last year intensively around this work. I'm going to just provide an overview of the context that BC Housing operates within at direction from our ministry, the Ministry of Housing and Municipal Affairs, and then Jen and Jerry are going to speak to the specifics here in Nanaimo. I'm hoping Council's aware of Belonging in BC. It is the province's provincial homelessness plan and strategy. It is a major shift in government to have a formal homelessness plan that brings together a whole of government response. We have not had that before in BC. Within Belonging in BC, we have a goal of making homelessness rare, brief, and one time, and a very clear recognition that that is not going to be done by one level of government, one organization, one ministry, that it is going to take the collective impact. As others have spoken about today, it is about collaboration, but we're going to talk about as well coordination and the importance of that coordination on the ground. That plan started in 2023 and included immediate actions to help thousands of people maintain and access housing and supports and drive at our shared goals. In select priority communities like Nanaimo, Belonging BC has brought new funding through initiatives like Heart and Hearth to work in partnership with local governments, First Nations partners, service providers, to ensure we have a shared strategy and action to make collective impact on homelessness. Over the last year, our priority with the team here in Nanaimo and at the SPO has really been getting Heart and Hearth off the ground. One of the things that we see that is working well and we want to double down on and sustain and strengthen is that strategic working group around encampment response planning. So I really want to thank Christy and John for the work that they put in to grounding in terms of reference that made sense here in Nanaimo and the work they do in participating in that table to bring the key leaders together in Nanaimo to set strategy and goals. What we heard at that table was a desire to focus on the downtown and on Bowen Park, but primarily on the downtown as an area where community partners wanted to see action, wanted to see change, and so that is where we're focusing. Across BC, homelessness is a major issue in regions and communities, and it can feel incredibly overwhelming. And what we have found is that by coming together, picking an area and a priority, it can be very hard, but picking that and focusing in, we start to build momentum, and people feel and see the change, and we get stronger and stronger investment in the goals together. We are also very focused on the Hearth temporary housing, and I won't steal Jen's thunder. She's going to speak to all the work that's being done. You heard about some of it from Christy as well. But bringing those assets online is critical. If there aren't homes for people to go to, sorry, homes and shelter spaces for people to come into, we're not going to make the difference on the street. We're not going to make the difference in individual people's lives. Thanks, Jen. And to that point, being very intentional about the tenanting plans for these sites. So tenanting for all Hearth assets is done through the Coordinated Access and Assessment Table convened by BC Housing. It's so critical that as those assets come online and nonprofits are operating them, that we are using the data that we have here in Nanaimo, the needs that are on those lists and identified by our frontline partners to actually tenant up those assets, to make sure from the ground, right into the buildings, we're creating the opportunities that people need. I'm going to just touch quickly on some of the medium-term goals. These are more new, and my hope would be if we're back here in 4 months, 6 months, or a year from now, you'll be hearing from our partners at the United Way, the SPO, and BC Housing together on some of the changes we're making. We have, over the last year, engaged directly with the SPO and United Way and their federal funders to find a way to align federal money that's coming to Nanaimo to address homelessness with provincial money, investment, staffing to address homelessness. This has been a major undertaking, not just for Nanaimo, but for 9 other communities in BC that get Reaching Home funding. We've had a desire to partner and collaborate, but we haven't had a way forward. And I'm very excited that at the end of last month, the United Way and the SPO were presented with an endorsed approach to bring their staffing and roles, BC Housing's staffing and roles here in Nanaimo, to work in very close specific partnership to drive change. We're hoping that an endorsement letter will come soon from the United Way, and we can move from planning and discussion about partnership to partnership in action. And really the goal in that work is about bringing together partners in Nanaimo to give them access to HIFIS, to make sure that we can share data between teams in a way that's efficient, so we do not have people sharing their story more than once, that we can make sure we're giving the IT underpinning to the folks on the ground that you've already heard about today. We're trying to make change in people's lives, so we can democratize data for councils, for the people doing the work, and that really we're all pulling in that same direction. And I'll just, before I turn it over to Jen, just say that when we have looked across North America at communities who have actually achieved that rare, brief, and one time, in communities where when someone becomes homeless, they are moved out of homelessness in 6 months, 90 days, 30 days. It's because all of the partners came together. They had some level of an IT system that could connect them and allow them to share. But they agreed at a community level on a same goal and a same intention. And whether you were the province of BC, a Ministry of Health, social development, poverty reduction, or a local nonprofit or outreach team, you were all working towards that same goal. That's the true north goal that we have through Belonging in BC, and that's what we look forward to working with the SPO and the city and the United Way on in the coming year. And more of the same, deeper, quicker, faster, I think is what we're driving at. And I'm really happy to be here today and happy to answer more questions on the provincial framework. But with that, I'll turn it over to Jennifer Fox.
Thanks, Allison. Okay, just a reminder, supportive housing overview. In supportive housing, it is a single sleeping unit. Staff are on site 24/7, so a minimum of 2 staff at all times. Meals are provided on site, storage, laundry, washroom, and shower. There's life skills training, access to culturally informed supports, referrals to healthcare and other services, and residents are 19 plus, including all genders, seniors, and persons living with disabilities. All residents pay rent, and it's persons who are experiencing or at risk of homelessness and who need supports to maintain their housing. We've got a table showing the current supportive housing in Nanaimo to complement Christy's map that she showed earlier. And so as you can see here, we have a total of 116 temporary and 172 permanent for 288 units, and they're listed here on the table, including Newcastle, which reopened recently with 50 units of Hearth, operated by Island Crisis Care Society and Violet's team. Cornerstone, which is the permanent supportive housing operated by Connective. Samaritan Place, 51 units of permanent supportive housing, again, operated by Violet and her team. Nikhil, which is operated by Pacifica, and that's a long-standing site, as you know, that's been open for quite some time. Uplands Walk is the 34 permanent with Pacifica, and then Wesley Street Housing for 36 permanent. And so you'll see on the other side of the screen that from our data, 294 people currently living in supportive homes in Nanaimo, whether they're permanent or temporary, as of March 31st, 2025. So that's 294 people who are housed. It's a very, very good number. 112 people moved out of supportive housing in fiscal year 24-25, and that's got a combination of reasons for why folks moved on. And now we're moving into future supportive housing in Nanaimo, and I'm going to ask my colleague Jerry Michael to come up, who's leading the very important work with tenanting and having folks move in. Thanks, Jer.
Good afternoon, and thank you for having me, Mayor and Council. I'm Jerry Michael. I'm one of the 2 coordinated access and assessment managers for Vancouver Island working at BC Housing. And I have the great benefit of being able to share some of the collective impact and momentum, which Allison alluded to, and that we're working on collectively with the city partners, local nonprofits, Island Health, and the SPO. BC Housing currently has 288 total units of temporary and permanent supportive housing sites within Nanaimo, and has 294 people living in these units as of March 31st, 2024. For many people with various needs, supportive housing is a permanent home. BC Housing is working closely on shelter provision and the HEART program. with local partners, so the Homeless Encampment Action Response Team. This includes regular meetings with the City of Nanaimo and local partners, and the CSOs with the city, and our homelessness outreach workers provided by BC Housing are sharing supplies through the HEART program. This includes winter survival kits, which were passed out, sleeping bags and hand warmers, as well as other survival supplies recently. Our CA staff are also connecting weekly with staff at the Hub shelter, identifying individuals accessing services who require supportive housing applications or BC Housing. Our BC Housing House are also providing vulnerable assessments, including VATs, to people accessing service theirs. 3 more Hearts, next slide please. 3 more Hearth sites will be opening soon in Nanaimo, including 1300 Island Highway, 1030 Old Victoria Road, welcoming their first residents in the coming weeks. For 1300 Island Highway, local partners through the CA program have already identified 22 prospective residents, with the next meeting of partners May 20th. 1030 Island Highway has 12 prospective residents already identified as well, with the next meeting later this week. The priority for these sites has been supporting individuals currently in shelter, especially those sheltering in the downtown area. The Sparrow, or the former Travel Lodge site, is expected to be receive occupancy later in June, and we'll be working with local partners through the CAA process to identify tenants as we have occupancy firmed up. Next slide, please. So I would just like to take a moment and just acknowledge the local partners that our coordinated access and assessment staff are working with locally. We meet, or our BC Housing staff meet with all of these partners monthly. However, with the increased sites, the nearly 200 Hearth sites that are opening soon, have increased our meeting schedule. So we have 9 extra meetings of these partners scheduled for about over a 2.5 month span. So a lot of collective heavy lifting is going on to make these sites successful. Other CAA activities include BC Housing staff and the SPO working closely to build out a by name list, or BNL, to identify the extent of individuals seeking supportive housing in Nanaimo. Collaboratively, we will be bringing local partners together next week at the SPO's office to compare BC Housing data with other local providers. Next slide, please. So just to finish off, we are currently supporting 95 permanent shelter spaces in Nanaimo, and last year did have 919 unique people access these shelters in Nanaimo, so that was through the 24-25 fiscal year. Thank you very much.
Thank you.
Thanks, Chair.
With us, any more presenters? So we'll take some questions here. Councillor Eastmere.
Yeah, thank you so much for the presentation. I just wanted to ask, so the shelters that are listed, I didn't see Risebridge mentioned as like either a partner that's invited to the CAA meetings or listed on the shelters. Is there a reason for that?
If you don't mind, we'll take turns answering questions if that's okay with you.
Of course.
So I'm just going to give up my seat. Thank you.
So Risebridge is a temporary winter shelter, and they did have the opportunity to refer their folks for supportive housing while they were operating, and funded by BC Housing. So there was space for them to join the collective efforts of that table through the winter.
Okay, appreciate that. And another question, if I may, I just wanted to ask about the shelter beds that are currently at the drop-in hub on Victoria Road. I believe that there had been a request from the organization to extend those beds if possible, and so I understand that May 31st is where they're funded up until at this point, is the intention that the people who are in those shelter beds right now will have the opportunity to move into the hearth sites?
So one of the goals in Heart and Hearth is that shelter should be an access or a gateway to housing. And so anybody who's in shelter right now in Nanaimo can be and would be brought forward to the CAA tenanting table. And if a shelter is soon to close, then that would be a factor driving the prioritization to kind of look at that individual and opportunities to bring them in. We did look at an extension to the hub shelter, given the outcome nobody wants, which is that a shelter shuts, folks are forced to go outside again, and then a couple months later you have housing come online, and you essentially force people through an experience of going outside to then come inside again. It's not a good use of their lives and experience, and it's not a good use of partners' time and efforts. So we did provide an extension, to sites to try and move that forward, and we are still monitoring that situation in terms of what can be done.
Okay, so it's uncertain.
It's uncertain if we can do another extension, but it is something that we have looked at. Yeah.
But you're basing that on whether the hearth sites will be ready for the people who are staying in those current shelter beds to be able to move from there into a hearth site without any
The
disruption.
goal would be to try and match those things up. It's like trying to land two planes on a runway at the same time. You've got assets coming on, people have been identified for those housing units, and trying to see what we can do the best that we can do with that. I will just say that temporary winter shelters, which is a program I have responsibility for across the province, we open them every winter, and it is a horrible experience that many of us have to go through in many communities to see those beds close as the weather gets better. And until we can have a shelter system that can provide enough space in every community year-round to meet every need year-round, it's a reality that partners have to kind of deal with and work with. It's not ideal, but it's the situation we're in at this time.
Is there anything that this council can do to support the landing of those two planes at the same time, just with regards to the drop-in hub and the hearth sites in Nanaimo?
Maybe I'll just start with some kudos to this council that there have been strong advocacy through to government around that, which is why the extensions was a factor, and the extensions for sure. And so I think this council's done a great job of highlighting the need and the importance of that. I guess I would say right now with partners, we're working on that the best we can with limited funding and resources to see what we can do.
I appreciate that, thank you. And I know it's a huge credit to the operators in Nanaimo as well, who've been able to step up and advocate and really do that work.
They sure have.
And it's an honor for us to be able to support that. And then you talked about the broader issue of, the shelter system across the province. Is it just a funding issue, or like?
There's a myriad of issues at any time when we're trying to support shelter delivery, and the temporary winter shelter program really rests on partnership. So BC Housing has funding through the ministry, and that's who funds the shelter program, and that's who we look to if there's any expansion in the shelter funding that we can offer to communities. And then we're really looking for communities that will step up and identify locations, be supportive through regulatory practices and land use to say, yes, we want to see more shelter, and we're keen to support that. So temporary winter shelter program is very much a partnership with local governments and local nonprofits. And then capacity, which you mentioned before, is an issue at all times, right? For the shelter sector, is being able to get enough staff on board and keep them on board through that work. So we're always keen to see more temporary shelter become permanent, but we're subject to kind of boundaries on funding that we have.
I think we'd be very interested in helping to advocate for a change to the winter shelter program, because like hearing what you're saying, it's not really working for even the people administering the program, let alone the people accessing it. And it is the fact that we need the long-term sustainable, reliable shelter beds all year round. So I think I'd be interested in a conversation on how to push for the sort of systemic changes to the shelter program. Thank you so much.
Great, thank you. Mayor Crow.
Thank you very much. Thank you very much, Chair. Firstly, thank you very much to BC Housing. I was remiss on Friday from not specifically pointing out it wasn't just government money, it's the agency of BC Housing that has so so wonderfully provided the sheltering space that is there at 1300 Island Highway. So I want to express my apologies. The second thing is there was a so-called cabinet minister who was rather bombastic, and he used to say every time the government made some great announcement, we would heckle across the opposition, more good news. I do note with interest that 187 and 155, by my math, don't come to 242 beds. They come to 342, so there's more good news here, and you should accept it proudly. Back to follow up on what Councillor Eastmere had to say, though, in terms of finding nonprofits who are prepared to undertake the work, that is challenging, and I'm going to assume, and that's really my question, that they have to provide a certain accountability in terms of being an organized society, filing annual reports, and doing all those things that ensure that public dollars are being used appropriately. And that is one of the problems you face across this province, I take it. Is that fair? You're on.
Am I on? Sorry about that. Thank you very much for your kind comments, Mr. Mayor. Yes, we do have agreements that we sign with providers, and there are expectations to be met within agreement, including effective use of funding dollars, reporting requirements, and uses of database. And so, yes, that's one piece. The other piece is BC Housing recently completed a request for proposal process. And so that was a qualifier list where we put out an RFP inviting nonprofits to submit proposals to operate supportive housing, and it includes shelter as well in there. And so we're very excited to have a nice healthy list that then we can send invitational RFPs to invite those successful qualified on the list to submit a mini version of an RFP response for future sites.
Thank you very much.
Thank you. Councillor Manley.
Thank you, Chair. Thank you, Chair.
So hold on. We have a battle between here and IT. I'm going to press on here.
Can you go for it?
Okay,
Yeah,
you're
there
good.
you go.
You're good.
All right. Thank you for being here and for the presentation. I know we're talking a lot about supportive housing, and you know that I ran a shelter for a while, and many of the people that we saw show up at the shelter didn't need supportive housing. They just needed affordable housing. They're like low-wage workers, people with disabilities, low-income seniors. I even saw a VIU student staying there for a little while. And of course, when you lose your housing and you're on the street, it's a key social determinant of your health, your mental health, your physical well-being, your economic well-being, and it really affects people. It's a culture shock for people showing up at a shelter to sleep in a bed, 2,500 square foot room with 25 other people. And so my question is related to affordable housing, and what are the targets for affordable housing for this community? And are there targets that are set, based on any community? Any community would have a certain percentage of people that will require affordable housing. Low-wage workers, low-income seniors, people with disabilities, students. And so that's the target I'm most interested in, is what are we going to build in this community to make sure that we stop people from falling into the river, so we don't need to pull them out of the river downstream.
Through the chair, we are preparing to launch a funding call, a proposal request for a community housing fund, and that is the affordable housing component. And so you will see, we think at this stage, potentially upwards of 3 calls could come out this year. And so we look forward to receiving submissions from local providers on what they could see as affordable housing possibilities in Nanaimo.
And do you have a target? Do you have any kind of idea of what a community our size would need? I know, like, Nanaimo's changed.
Yeah.
25 years ago, you could buy a house here for $80,000. You could rent a house for $500, and those days are long, long gone. So if you're low income and you're surviving on minimum wage, even a 2-income family, market rates today just don't cut it. So we know that a community this size is going to need a certain number of affordable housing and a certain amount. And I'm curious if BC Housing or the government is looking at that. because we've seen real estate become an economic driver. It's been an economic driver in this province for a couple of decades. It has created a huge, huge problem. So I'm wondering if there is a target, if there is a percentage, is there some way of determining what we need to do to build our way out of this mess?
Allison will answer that one, thank you.
Just jump in to say, the provincial housing needs assessment is probably the most easily accessible target in terms of how the province has estimated the need for affordable housing based on population demographics. I think the SBO is probably going to touch more on this when it comes to them at the end. But as a city who wants to drive change in homelessness from the street through shelters into supportive housing, that aspect of adding that affordability is so critical, right? Otherwise, what we essentially hit is a wall. People can get into supportive housing, but where can they go on to? BC Housing brings, with our federal partners, different rent supplements, some with supports that can help folks who are ready to transition out of supportive housing, or as you say, have landed through some experience in life into a shelter and don't need supportive housing, but need that assistance to get into the private market and rent something. That'll do something, but I like to say there's no silver bullet within this. It's all the different measures along the housing continuum. So you can look at the provincial call for, or what the city of Nanaimo and should be maybe adding based on demography. But I guess having that plan yourselves within your own housing strategy that says, based on our view of demographics over time, what do we need in Nanaimo in our housing continuum is a critical part of that. As Jen mentioned, CHF is coming and those calls are there and nonprofits will answer. Those nonprofits will be more successful if they're saying, I'm in a city that has got me the land use and the zoning that I'm going to be able to really make this go, and it's going to be a great success. So that's a lot of what will drive how much comes to Nanaimo in terms of that investment.
Okay, thanks. I have another quick question. One of the things I discovered operating the shelter is that people would show up at the door who said that they were on the BC housing list, and then when we checked, they weren't on the list anymore. And I understand it's about a year, and you have to check in and you have to be engaged in the process, otherwise you just fall off the list. And I don't know if there's been a change since I was operating the shelter, or if there's another way of making sure that people stay engaged before they end up becoming unhoused in our community. Because we just found out a lot, that people were on a list, they knew that they were going to be in trouble at some point because they couldn't pay their rent, or the place that they were in was going up for sale, or things were coming to a crisis for them, and then show up at a shelter, we run them through the VAT process, and then they find out that they weren't on the list anymore.
Through the chair, we do have the requirement for the housing registry to have that annual check-in at minimum so that their file can continue to be live in the system. We also, as those who have operated shelters would know, we've got the supportive housing registry, and that is an opportunity to check in and update the file from time to time. We also have, although the majority of our housing applications are managed out of our home office, so it's all centrally managed. We do have our team in our region, in our Victoria office, that's led by Jerry, where they're doing the updating of supportive housing files. We have folks who reach out just to ask if their file is still live and just to do that check-in point. And so that team provides more of a personal touch conversation when we have those reaches out.
Okay.
Yeah.
Yeah, I imagine there's a lot of people on the list, so reaching out to them is going to be a major employment driver for the organization. But just I like touch points, I guess, with other organizations. Do you have touch points? You must have touch points with social services as well for people to make sure that they remain on the lists.
We do, and we do have the encampment response work that we're doing together collectively as partners in community as part of the MOU, where we're having the regular strategic working group table. And so we have the leads of the various organizations bringing forward issues that their teams and frontline workers have brought forward, and we talk about it at the table, and we can strategize together on how to get that reach out more fully.
All right, thank you.
Great, thank you, Councillor Manley. Councillor Armstrong.
Thank you. Mine's on selection criteria, and my bias is going to show here. I sit on the board of the Alano Club, which is for people in recovery. And we have so many in the club that can't find housing because they're in recovery and they don't want to go into supportive housing because they don't want to be around drugs. Or another lady came back from detox, was put back in the supportive housing unit and started using once again because her dealers are there, all her friends are there. Is there going to be a move where we can have what I call second-tier housing, where it's for people that are in recovery that don't need 24/7 supports but still may need weekly supports? I've talked to other people, and this is going back a few years, mind you, where they're sitting in fully supportive housing units and say, I don't need to be here, but there's no place for me to go. So we're spending all this money for them to stay in a place where they don't need. If we could have, like I call it second tier or phase 2 housing, where you do really well in phase 1, now you're into phase 2 where you still need some supports, then finally phase 3.
Through the chair, currently with the supportive housing program and with the HEARTH program, it is a housing first, harm reduction philosophy. And so that's where we're meeting folks where they're at, to have them come indoors and offering that support if they choose to use substances. With respect to the recovery piece, I'm sure Allison could speak more to this, but there are conversations happening provincially to explore further partnership between the provincial governments for the recovery piece, but within BC Housing's mandate at this time, it is looking for the harm reduction approach.
Thank you.
I would just add, yes, as Jen says, there's a lot of interest in this question around what could be on the housing continuum for folks who are on that recovery journey. And I know our health partners are here as well to speak to these pieces. We're working through some of those models and looking for opportunities to see that. And really, we really rely on the local nonprofit providers as well within their, as Jen mentioned, their submissions for things like the Supportive Housing Fund for models or plans or intentions. It has to be workable, right? It has to be data-driven. There have to be the numbers to support that. And so right now we do have a significant amount of individuals experiencing homelessness who need that lower barrier housing, and we are looking for opportunities to find that, add that extra into the continuum. That is very much a health service connection as well, and so that's really where BC Housing has to work with other partners at Island Health to see those kinds of models grow and opportunities grow.
Thank you. That's where my philosophy differs, because I believe we should be helping those that want help first so they don't fall back into the cracks. And I'm watching the Alberta model very carefully, and I did a lot of research into Houston, San Francisco, and LA. And just for those that know, today Governor Newsom has now declared encampments can only stay for 3 days, and they must be moved, or their cities are going to lose their funding. So there's a big movement towards that. Houston is now looking at therapeutic communities as well, which from my perspective, having sat on that board as well, great concept for those that want help, teaches stuff, and it's a heck of a lot cheaper than what we're doing. So I really hope the government looks at different models to support people in their different areas of where they're in recovery. I mean, everybody's in different areas, and right now I just think we're supporting people that aren't even in recovery, so I struggle with that, but I think we need to find a balance. Thank you.
Thank you. Councillor Hemmens.
Thank you, Chair, and thank you so much for being here. Congratulations on we did a tour of 1300 Old Island Highway. What a lovely facility. It really looks like a space where people can thrive. I want to acknowledge that, and I recognize this with everyone in the room, that we're operating in an environment of deficit. We know that we have about 1,000 people on the streets, and we simply are not building quickly enough. We don't have the land, we don't have the shelter, we don't have the health services. So if there's any tension in these conversations, I think we can trace it back to that. And I know most of the people in the room today, and I know them all to be really kind and caring and wonderful individuals who are all rooting for the people in Nanaimo. So thank you all for being here. Following on Councillor Armstrong's question around recovery-focused housing and meeting people where they're at, I agree with her that we need a balance. I'm looking at your slide here that identifies the 78 temporary hearth sites at Sparrow for individuals who are on a path of wellness and stabilization, health and housing needs. Would it be fair to say that that's a recovery-focused facility?
Through the chair, the initial conversation about project was brought forward by SPO with respect to having, this is not my phrase, dry site. And so.
I'm sorry, I didn't catch that. What was that?
Dry site.
Dry site, thank you.
That's not BC Housing phrasing, that's how it was
Right.
presented to BC Housing. We had the opportunity to have lots of collaborative conversation about how can we fit concepts of that model within the funding program framework that BC Housing delivers within, which is that harm reduction. We were able to arrive at the CAA process in terms of how we select who moves into the Sparrow. And so the Sparrow is identified for persons who are looking to reduce exposure to substance use and alcohol. And through the CAA process and the housing options coming online, it is unofficially a bit of a tiered process in itself in terms of some sites are much lower barrier perhaps for people with maybe higher needs, and then we have other sites that are maybe not as acute in terms of their support needs, and that would be the Sparrow that would fall under that category.
Thank you. That's reassuring to know that we can get there if we want to get there. You know, that whether we use the same language of dry housing or not, that's a direction we can see ourselves going in, because I think, like Councillor Armstrong, it's really important for community members to understand how this spectrum works, that we have places for people at kind of meeting them where they're at. Some of them are in recovery.
If I might just add a bit more in terms of, I've already referenced the table that our organizations are collectively participating in terms of the strategic conversations. We're also at the CAA table together, and so that slide that Jerry spoke to, where we had the logos for all the different organizations who are part of that conversation, it really is all of us working together in terms of the tenanting and how we approach this.
Right.
So thank you to everybody.
Thank you. I want to ask you about flow-through stats. So on one of your slides here, you talk about 112 people moved out of supportive housing in 24-25. Are these statistics that we keep, and do we know where they're going? And this goes back to Councillor Manley's question about ensuring that we're not overemphasizing supportive housing and then not building affordable housing, and so we don't have somewhere to flow people through, and so we're kind of getting a logjam at the beginning. So any comment on flow-through stats and whether that's even helpful for us to consider?
Yeah, my hope would be, Councillor, so through the chair, my hope would be in the future we could bring more detailed reporting and data to council, hopefully in partnership with the SPO and with Christy. That flow-through number, that 112, is a mix of things that have happened in the supportive housing continuum or place in Nanaimo in the last year. There will be people in that 112 who have reconnected with family or friends and have left supportive housing for that situation. There will be folks who've gone to recovery or gone to detox. There will be individuals who've left Nanaimo for other communities and other places. There will be people who have passed away within that 112. And there will be people who have moved on to other kinds of rent supplements or other types of housing. It will be quite a mix of outcomes within that 112. That data is collected as part of contractual agreements between nonprofits and BC Housing through one of our many database systems that they work with. I spoke earlier to the work we're doing around HIFIS and the kind of collective data and dashboard work that we hope to come to. And my hope is that down the road we will be giving that kind of analysis at the Nanaimo level together. We'll all be looking at the same data and looking what's happening. We know we have some barriers for people to move on from supportive housing. We also know, as Jerry said, many people will spend the remainder of their life in supportive housing, and that's the dignified option that we would want for them. And what we hope to do is more and more provide rent supplements, provide other opportunities to move on and out into other pieces, but it will take all those pieces, the affordable rental, the rent supplements, the partnerships, the connection to family and friends, the social cultural supports, to make that happen for that community. So I don't know if that provides a bit more
It does,
nuance.
thank you. Thank you for that. And I'll just share the genesis of the question is, sometimes we hear anecdotally that housing providers will hold on to stable clientele because, as we know, and we heard this, that the acuity is getting more intense, the drugs are different, people are showing up who we haven't seen before. So if you're housing 50 people, some of them are in active substance misuse, and some of them are in recovery. You know, there's a whole spectrum. Yeah, I'm just, that's the genesis of the question, that folks are holding on to the stable clients so folks who really need, who could be moved on, are getting stuck in that system. They're not even able to go in the door because of the stability of the folks in the unit. So I don't know that that's true. I'm just saying that's where the question is coming from, and why I'm curious about flow-through stats and how we can ensure that our focus isn't just on supportive or just on shelter, but that it's on the whole spectrum.
I've heard this story as well, and so this is a real opportunity, I think,
Great.
to myth bust within the housing sector. Do nonprofit partners through coordinated access look at the kind of needs within a building to make sure that the building is going to be a successful community? For sure. Holding on to people, I think, is, and I've heard this, and so I'm not going to credit you, Councillor. This is a thing we hear across BC. It's a story that gets told. It's a discredit to the nonprofit sector and the individuals who work in that building who want only to see individuals succeed and get into their housing. The major barrier for people leaving supportive housing is the affordability of the next opportunity. The fact that supportive housing comes with also food, community, social and cultural, that is a big hurdle for some folks to give up to go into even a supported rent supplement. You lose that connection with the people around you. So there are many folks who that community is part of what is sustaining and keeping them going. So there's many factors that will limit that. I don't believe, from my experience working with the nonprofit partners, we have people holding on to people or holding people back in order to balance buildings. You can never say never, but that's not what we observe when we review our providers.
Thank you. I really appreciate that. Chair, with if I may, my last question, speaking about the facilities at 1300 Old Island Highway, I'm curious if we can have comment about why sites look different, even new sites that are about to open. And I say that 1300 looks beautiful. You know, you can really see how someone can succeed in that. Just up the road, we have another facility that's also about to open, the same funder, but it looks quite a bit different for the neighborhood. So if I can have any comment on why the variation, that would be great.
Thanks. I'm going to try and answer the question on behalf of our colleagues in Development Services, so please bear with me through the chair. So what happens is we do put out requests from different contractors to bid on our contracts. It depends on, as you would know, the size of the land, the services available, and timelines and funding on how fast we can get the units delivered. We had great success with 1300 Island Highway, and the assets that have been delivered are, as you saw, very, very great. And we are hearing some feedback from some folks who are questioning the workforce housing style. And so that would be a case of being able to get that asset in within the timeline and the budget that we needed. And I'm happy to take the question back to our development colleagues and send in a response through staff to provide a more fulsome answer, if that would be helpful.
Thank you. Thank you. That would be great. Thank you, Chair.
Great, thank you. Yeah, just on my end, it's really heartening to just hear the amount of collaboration and coordination that is happening. Even given 4 or 5 years ago, the difference in how we're communicating about this, the discussion about flows and building a system that can address people in the shelters, so that touch point, and then move them through the housing and health spectrum. It's great to hear, and then also to have that sort of IT informational base with HIFIS and coordinated access. And I really do feel that we're moving in the right direction, despite being within a tidal wave of need. We're shoring up what we have, here in Nanaimo and with BC Housing and Island Health to be as effective as we possibly can, given the circumstances. And one of my questions is just with the IT base with HIFIS. I know that's been quite a project to get that online, and is there any updates in terms of the timeline that will be online and be able to access? 'Cause I know it's been in a lot of work, and I'm just curious, update on that in terms of its progress.
Yeah, thank you. Through the chair, the exact timeline in which the Nanaimo HIFIS onboarding would roll out for all community members is still TBD. The first step really is this agreement with the SPO and United Way on partnership at the kind of staffing level. But all the work is being put in place to come to a provincial standard on the use of HIFIS in partnership with our Reaching Home colleagues in BC Housing, the province, and the federal government. So this summer, fall, there is considerable work that needs to be done on HIFIS to configure it to a standard that we've all agreed on. And then we'll be working through the 9 key communities to bring our nonprofit partners and broader community partners with it Reaching Home onto HIFIS and using that. We're going to focus on vacancy matching, so the work that Jerry was talking about, coordinated access, that'll be the starting place, and then we'll be building out, looking at outreach teams and their access to HIFIS, our shelter providers. It's not a small undertaking. We have a lot of providers, there's a lot of staff, there's a lot of training. We want to do that in a way that's coordinated. But I'm very excited that I would think within the year, we're going to have a lot more to share. And as I keep saying, coming back in partnership with the United Way and the SPO to share on our collective efforts to get HIFIS out into community and being used to its fullest. It's been a real missed opportunity provincially to take a tool that could do so much and use it in a very narrow way. And I'm excited that we're going to blast that open in the coming year.
Awesome. Well, I appreciate the focus on it and rooting for everybody to, solve any problems that need to be solved and get it going. My last question is just in terms of, really appreciate the vision of, being able to use outreach and shelters to see where folks are at and then building out this housing spectrum to be able to move people to the appropriate type of housing and services. And one thing that, was in the report and what we're seeing is with this hub that we have here in Nanaimo, having that sort of daytime presence, being a really excellent location to be able to work out and connect folks with the services that they need. And then also to solve that problem where we have these warming centers that all of a sudden the cold weather hits and everybody's scrambling to find staff and a location where we can have, a setup hub that runs through the year, and then it has the connection with the staff and the location that when we do need to beef up services, it can happen much more seamlessly. And I know, the discussion's ongoing, but we do have a meeting with the minister specifically to discuss investing in this type of infrastructure and services. And just curious, has this been identified as an interest and focus with BC Housing to look into how we can maybe utilize and develop this tool?
For the regional aspect of the hub, it's been working well. And we will be having a follow-up conversation with city staff about the potential for, should funding be available, for the hub to continue to receive the BC Housing funding past the end of May. I'll defer to Allison for the provincial piece with respect to daytime and warming spaces.
On the question of warming spaces and coordination, I think there's a real opportunity through our strategic working group to bring partners together to look at what we want to bring on for next winter in a more considered and partnered up way. We generally at BC Housing, through the Temporary Winter Shelter Program and EWR, we don't say no to anybody. You come, we try and work with you to get something opened up. That does end up with a kind of mixed tapestry of opportunities in a community. So through that strategic working group that Jen has been referencing and I've been referencing with our partners, we have the opportunity, I think, to look at a forward plan for next winter for Nanaimo and really think about where the best locations are and opportunities are within that. So I think there's some opportunities for next year for sure.
Wonderful. Thank you so much. Great. I'm seeing no other questions, so that will bring us to our next group of presenters. And just checking in with staff, do we have a scheduled break, or are we thinking about breaking at all?
Yes, thank you, Chair. The scheduled break is for 3 o'clock, so we probably have time to go through the next set of presenters. So. Great.
So yeah, ask Island Health to come up here. I guess I'm not sure. I've got Amanda Lemon first on the list, but Lisa Murphy, whoever, however you guys set it up.
Thank you. Thanks for the opportunity to join us today, Mayor and Council and partners. There we go. It's a real honor to be able to join you here today. I invited my colleague Amanda Lemon up today. You will see, I'll just start very quickly to say you'll see it says mental health and substance use and addictions medicine and substance use. Just for very brief context, about 6 to 8 months ago, mental health and substance use and addictions medicine did reorg, and we now are 2 portfolios, which was really, Amanda can speak more to it, but it was really to emphasize and provide a real spotlight on much of what people have been talking about today, the addictions medicine and substance use aspect. So our services are on paper, on an org chart divided, but we work very closely in partnership on many programs and many services. We also have our colleagues Mike Kirby and Brody Tapp here today, can help with answering any questions. So what we did, acknowledging that we're privileged to serve here on Snuneymuxw Nation, and really appreciated the comments about collaboration. I think that probably answers this first question really well. What is working well in addressing homelessness and the basic needs of unsheltered individuals in Nanaimo? So we met and listed some things, and we'll probably go back and forth between them, but we wanted to start with the ongoing resources through BC Housing and the Heart and Hearth programs. Very probably oversimplifying things, but it is possible and very difficult to offer health services, whether it be mental health, primary care services, substance use services to people who are living unsheltered. So all of the ongoing resources that are coming have been incredibly helpful. Creating transitions and flow from homeless to shelters and through to temporary supportive housing. We've talked quite a bit about that today. We also recognize the need for housing with minimal to more supports for people who do live in recovery and are moving into recovery. So that's also been something that we would echo and support. People coming out of withdrawal management or treatment to go back into an environment that's very similar to what Councillor Armstrong described is a risk. It's a risk for them, it's a risk for their recovery. The Hub Daytime Shelter, been a huge benefit in terms of our team's ability to reach in, support people. We also hear very positive comments about that from our hospital partners, Emerge physicians, in that they have a place, very difficult to discharge people to homelessness, but a place that they know that teams can connect with them, reassuring to them in terms of that flow from hospital. Outreach teams and services, as was mentioned today, I think by Marina, the relationship and collaboration with CSO, huge in terms of day-to-day work. Interagency collaboration and creating assertive linkages between housing partners, housing providers, and clients. And I think the really important word in that is assertive linkages. I think we can all talk about collaborative relationships and partnerships. What I see here in Nanaimo is that the linkages and partnerships are quite assertive. We meet, we have real action plans with many of the people across this group, and I see real positive outcomes that come out of that, measurable outcomes. Do you want to do the next one?
Okay. Oh, excuse me. I was sitting and not speaking. Thanks for having me as well. I'm Amanda, and I think since the last time I've seen all of you or been here for all of you, I've changed positions a little bit. So I'm previously representing all of the mental health and substance use outreach teams, which Mike now supports, and I've moved into a position with the Addiction Medicine Substance Use Program, which is newly formed within the Health Authority to build up substance use continuum of service and build up addiction medicine as a medical specialty for treatment. So we're looking at things a little more regionally. So just wanted to say that I have a bit of a different hat, but thank you for having me. So when we look at what we do need to address some of the critical needs and issues that are facing people in the community. Go forward, Lisa. there's quite a bit that we can still do. I will echo what Lisa and what Marina have both said, and just working in this community and caring about this community for a long time, I think the relationship and the collaboration amongst people who do the work in the community is probably stronger than it has ever been, and we are getting places. It's difficult and it takes time, but I do want to acknowledge that. For us in providing health services, like Lisa said, if there's more access to spaces where we know people are or we can find them, then we are able to go there and provide more health services. A lot of what we're hoping to do in the substance use continuum is do some early work too. Councillor Armstrong, you might appreciate this in prevention and health promotion along the continuum of substance use care. So that's a new opportunity, not a new opportunity for us, but an opportunity to look at that a little more closely. And I think one of the other big things is for us to be able to develop meaning for people who are living in our community and feel part of our community. There's lots of organizations who have work opportunities, vocational opportunities, recreational opportunities, and I think the more we can have, our team believes that the more we can have those positive, stable opportunities for people, the more that the successful kind of integration back into society for people who feel like they've been outside of their community for a long time. And let me just see, anything else I'm missing? I think one of the things that we have been doing in the last 4 years is it has been reactive to some extent, and we're just kind of coming out of that pandemic umbrella where we created services very quickly to meet the needs of community members in a really changing environment. So what we are hoping to do is have some more stability and have some proactive planning, increase access points for people so that they can come into care. Part of substance use overall, there's a provincial initiative, I'm sure many of you are familiar, called Road to Recovery, that each health authority has been asked to initiate throughout their region. So the primary pieces for that are access and equitable access throughout regions and an increase in bed-based services. So those are all initiatives that we're working on. Some will directly impact this community. Some will impact some of the other more underserved communities across the island, but the access should be similar for people depending, regardless of which community they're in. So.
What more is needed to address homelessness and the critical needs facing unsheltered individuals? So the things that we really, that came to mind for us was having services spread throughout the city and region and not concentrated to the downtown area. And of course, Christy spoke to that. Building relationships with outreach teams and community partners and unsheltered community members. There are also different levels of comfort between service providers in providing services through risk assessments. And we see that even within our own services with Island Health, a difference in how a risk assessment is interpreted by one department versus another. So really working to ensure that the right teams are offering the right services at the right time to people so that trust can be built. Anything we can do, of course, to advance trauma-informed, harm reduction, and health promotion approach to care, engagement, and client-centered trust. I think a couple of people mentioned that trust in systems, trust in people has been broken. So that slow and timely engagement around rebuilding that trust from a trauma-informed perspective. And then
I would add to that probably too, and we don't have it listed there, is having the opportunity to learn from people who are experiencing homelessness or who are underserved in our community. I think we've come a long way as a community in terms of providing what could be perceived as safer and more accessible care for people, but I think all of us have still a long way to go. So I'd be really interested in hearing from people with lived and living experience within our community about how we are doing. a little more and advising us on what we need to do in different areas, because we hold a lot of power within the health authority, and we really want to know what people need in order to feel comfortable accessing service, or what we need to do and to improve their quality of life and their health outcomes.
Thank you. Happy to take any questions from Councillor Mayer.
Great, thank you so much. Councillor Perino.
Thank you, Chair. And a question through you. Ms. White talked about the fact that, in particular, children not being able to access mental health supports. And I was wondering, do we have any psychiatric care available for youth? Or do they get lumped in with adults?
Yeah, separate program within mental health and substance use geared to children and youth.
Yes.
So not lumped in with adults in any
Okay.
way. And even in NRGH and Emerge, many hours of the day, about 10 hours of the day, there is a child and youth worker in Emerge to assess and connect with families.
With youth.
Connect them to that whole different range of services that many of us in the adult world are not experts in. So they are quite separate and probably
Yes.
very appropriately.
I thought it was an excellent comment, because it's just not something you necessarily think of, and it's,
Yeah.
yeah. And do they, when you go out as outreach teams, are you looking for youth in trouble? Okay.
Yeah. So there are kind of outreach teams that are generally serving a more adult-based population, but will absolutely engage with youth. But there are other outreach teams out there who have youth that they have relationship with or are actively out seeking. So we're talking about youth who are living in really high-risk situations, maybe living outdoors and engaging in substance use. Yes, there are dedicated services for them. Likewise, to what might be experienced in the adult, where there's not a lot of bed-based places for
Can you
children.
explain that just a little bit more for me? Just
Well,
very
we're
brief.
hearing a lot about detox and treatment, and
Okay,
so
so
it's a
it's
little
that.
more, it's
Okay, I
challenging
gotcha.
for the youth population as well.
Okay, and if one more question, if I might, I'm not even sure how to ask this question, but I was told that when people who are having issues and need to go to NRGH, that sometimes they're getting private rooms and other patients are put in the hallway, and I thought, I can't understand that. I don't see that. Having worked in healthcare for 40 years, I don't see that. Are you seeing that? Is that something, I'd love to be able to dispute that wherever I can.
Yeah, I haven't seen that. We work very closely with Nanaimo Hospital partners. There absolutely could and would be situations where a patient requires a private room.
Of course.
And that need would be considered, and absolutely, I'm a nurse by background, caring for anyone in a hall.
Of course.
Is not ideal,
No.
but it isn't, it would be based on need.
Okay.
And not
Not just a, okay.
not on patient profile.
Okay, good, thank you. I appreciate that, thank you.
Great, thank you. Councillor Armstrong.
Thank you. I think it's for you, but I guess I'll find out. When people are out and we see, and I used to see it, that you find mothers that are living in the cars. It's quite often mothers, because then they'll get the station wagon. Well, it used to be station wagons, now it's vans, and they don't want to come forward because they're scared of MCFD. If you come across these, do you have a policy where you can work with the mother unless the child's in harm without notifying MCFD, or does MCFD have to be notified right away because she's homeless?
Well, yeah, I mean, I can take that. I'll try. I don't work for MCFD, so, but I'm a clinician as well. I'm a nurse as well. You do everything you can to work with that parent and create safety and trust and relationship and make sure everyone's okay and meet whatever their needs are at that time. If there's no imminent risk to that child, then that would be,
Yeah, that's
you
good.
know, there is some clinical judgment involved, so not every situation's the same. Everybody living marginally, having been reported to MCFD. I don't think that's realistic. We have so many families who are living on the brink of homelessness, who may be staying with other family members, living outdoors, living in cars, and so I would say overall, no.
Well, that's good
MCFD isn't alerted, but that's, I'm probably speaking outside of my
No,
my
that's
area.
good, just because they're homeless doesn't mean they're a bad parent, right? You know, and I think sometimes you'll find they're putting their needs of their children ahead of themselves, so, because I do hear that, or I used to hear that, like, I don't want to be, because it's to what Ms. White said, you know, especially with the Indigenous communities who've had horrific experiences with some of the MCFDs, not all, they don't want to reach out for help because they're scared of the threat of losing their children, so they live in bad circumstances. So I just think that's another message. I don't know how you get it out, but I think it's important to get out that we're not here to take your children, because I think so many homeless women believe that to be the case, so they don't want to seek out help.
Yeah.
I don't know how you do that messaging though, unless it's through your outreach teams, but.
And we see that in emergency departments
Yeah.
and counseling outpatients, so it's a very kind of delicate situation to try and build that trust. We do have a small called Partners in Parenting program that works with primarily moms, but parents who are struggling with substance use. And then there is, through that child and youth program that Councillor Perino was asking about, there is a pregnant and perinatal program attached. Very small. I can say openly there's not been enough investment and interest in that population. So much stigma around being a young parent or a pregnant mom with a substance use issue. It's
very much
hard
so.
hard to reach out.
Yeah, thank you.
Thank you. Councillor Hemmons.
Thank you, Chair, and thank you both. Ms. Murphy, you said that the hub is making discharge from hospital easier. Can you please just confirm for me that hospitalists or whomever is doing the discharge, do they call the hub and say, do you have space for this person who's being discharged, or are they just being dropped off on Nickel Street?
I would say more the latter. They're being, people are competent, capable to make their own decisions as part of the discharge. So when they're discharged, it's identified to be a space, if they don't already know about it, that they can have their needs met, that teams like Mike would support, for example, can meet them there, the primary care outreach team. So it's a central location that people can come to. I probably overstated if I meant it as a discharge destination. It's a supportive environment that people can go to.
Supportive environment, okay. Thank you. I think I don't have a question, but I do really want to surface. I agree with everything you've said, that central location where services can meet people where they're at. That's food services, that's health services, that's wound care, all of the above. All great. It's hard on a neighborhood. It's really hard on a neighborhood, and I think I would be remiss to not say that with my South End folks sitting in the room here. Personally, I live in the neighborhood. I was driving down the highway, and there's a gentleman just hucking a knife at a tree and just making it stick. And if he missed the tree, it would have come into the highway. And these are challenges that the neighborhood faces every day. So yes to everything you're saying, 100% yes. And we can't ignore the fact that when we say this is a space for people to come to without actually having a bed or a service provider to say, yes, you're going to go to see this person, it's really challenging, and that's not anyone's fault. That's not anyone's, that's our collective problem to work through. So even with the increase in bylaws, increase in CSOs, increase in clean teams, it's still really tricky. So thank you. I know that you understand that trickiness, and I just needed to say it. Thank you.
I think we would advocate in the same way for a more dispersed service model as well. Like our teams and services have historically, gone into encampment areas in the North End and different areas where we're not actually feeling like we're effectively providing service to people because they're not openly visible and they don't have anywhere very close to where they are located or their belongings or their family or their community is located to go. And because that's why a lot of the services are mobile so that they can go to people. But if there is a safe space where people are concentrated, even last year, or the year before, when Island Crisis Care had the warming center on Bowen, it created a difference. It was a bit of a different population to serve, and then they had more consistent access to health services at that location. So dispersed model is really beneficial, I think.
Thank you so much.
Thank you. Yeah, just following up on that, I think the dispersed model and then, spaces that are, more intentionally designed and set up for that purposes, I think that's something that's worthwhile focus for, I guess, everybody to put their minds to as we move forward. My question is just around, the process of, folks getting into the shelter and outreach workers and then moving them through the health and housing continuum. Just around that one section for detox. 'Cause I know for some folks, just like that stabilization period is so critical to get them to a place to be able to, access housing or other services. And the wait time, I think is everything. That's something a lot of people have been struggling with and reported on. I'm curious, is there any more investment and expansion of the detox services for Nanaimo, and like what the current wait times or targets that we're hoping to achieve? Thank you.
We could probably have a whole separate meeting to talk about the substance use continuum of care, but it is really important to understand the pieces that we have and the pieces that we're missing in each community. So part of the Road to Recovery umbrella is just that, increasing access. So bed numbers in overall to the continuum of substance use care, which and with a treatment and recovery focus. So focusing on increased access and availability to what I'm hearing referred to as detox, which is acute withdrawal management, so medically supervised withdrawal, people who are at risk of medical complications and require medicine to come to remove the substances from their life. And that's usually a 7 to 10 day length of stay. And then there's other parts of the continuum, stabilization, landing point, where people may or may not be using substances. Sometimes it's a break from substances, sometimes it's stability before going on to further treatment. So there's a variety of different types of service on the substance use continuum, and that's the goal of Road to Recovery, is to have further access to the whole continuum for the Island Health region, not just Nanaimo specifically, but and having a little more equitable access across the island. So focusing on some rural remote communities and supporting with transportation. We can't provide acute withdrawal management services in every community. They're very HR intensive, high nursing resource, but we can work to get people with their family support to different locations. So that's the umbrella of Road to Recovery. Happy to come back and talk a little more about it, but the goal is to increase the bed numbers for acute withdrawal management and improve locations for some of those services, and then there's different initiatives in some of the different communities.
Great. So thanks for that. And so just for clarification, there has been sort of an increase. I mean, you're in a different role as well, for that. But there's been an increase in sort of focus on this pathways to recovery to build out the spectrum of care, and that's a focus, of the government going forward and resourcing.
Yeah, and likewise, with the discussion about having safe housing to come back into once you've completed treatment.
Yeah.
Right, so it's building several continuums at once so that people have what they need.
Great, thank you so much. That brings us to 3 o'clock. I'm not seeing any other questions for the current presenters, so we will take a recess here for 10 minutes. That work for everybody? To stretch our legs and get some water. Thank you.
Properties. Seen here where the orange safety fencing is installed around each property connection to the sewer. Given the access challenges, mature vegetation, and proximity of existing structures, the impact of the traditional method of digging up the entire sewer was not preferred. The existing pipe material and soil.
And we have our next presenter, Eileen Gillette, Director of Public Services and Planning at Vancouver Island Regional Library.
Well, I want to change that to 2025. Yeah. I just want to say thank you, Mayor and Council, for having me here today to talk about the library and some of the work we're doing and learning so much from all of you. Thank you. And just a little bit about the library. We have 39 branches that span an area of 42,000 square kilometers. So it's a large service area. We're the 4th largest library system in BC, and the library offers a range of collective services committed to the livability and affordability in the region and enjoyed by nearly a third of residents. So mission and vision, what grounds us? Our mission is set out by legislation, and that we must be inclusive to all. So it's a tall order, right? And we're constantly looking at how we can serve better and lift our communities up in some really specific ways. And I think it's important to note, we've been doing this work for 89 years. We just celebrated our birthday. And we constantly surprise people regarding the work we do and conversations like this and the collective services we offer in the community. We have 3 libraries in Nanaimo, Nanaimo Harbourfront, your neighbor, Nanaimo North, and Wellington, and the Country Club Mall. And just a little bit of our stats here. We see 1,200 daily visits in the library. I love walking around just 10 minutes before we open and see a lineup, right? We're not offering any fresh croissants or anything exciting, but, and in last year, we hosted almost 400 programs attended by 11,000 people, and we serve all demographics, and we have the 3rd largest collection in BC. So when we talk about our work with vulnerable populations, I think it's important to look at the national, provincial, and local context. As you know, we've talked about it today, communities across Canada and here in Nanaimo, we're facing big challenges in accessing affordable health care, folks getting the services they need to address mental health and addiction issues, and we're still recovering from the impacts of COVID-19. And these challenges are seen in many places: parks, community centers, businesses, and us, the public library. And in a lot of ways, although we may have different service models, I really hear today, and I've been in other conversations, we have a lot in common in how we're responding and the conversations we're having internally and externally, because it's really impacting how we work and changing how we work. So today I'm going to talk about some of the strategies and service we're doing in the context of our strat plan, because so we can get to know us and talk about our work. Literacy, recommitting to improving literacy levels across our region. 4 out of 10 adults face challenges with functional literacy, which is alarming, especially when literacy is a key social determinant of health, and the cost of this can't be quantified. And you think of literacy in different areas of our life, political, social, just how folks retain and get information online, right? And this goal is about working well with others, and I heard this a lot today, partnership, right? And we really see this goal working with public schools, post-secondary, nonprofits like Literacy Nanaimo, and more. Now, I could talk a lot about the work we're doing in early literacy and family, but I decided to talk about just community literacy, small c. So at the library, particularly at Nanaimo Harbourfront and Nanaimo North, we have, the 2025 Pocket Guide to Surviving in Nanaimo. We also have a range of different resources and sheets that we give out to folks that come to us, but also we leave around the library so folks can grab. We have bulletin boards around the library, particularly when you come out of the washroom, where you can find out where the recent meetings are, where food is, just really key information in the community, as well as for staff, back of house. We have a list of emergency and non-emergency numbers, particularly the CSO officers, which I hear a lot. We call them, that non-emergency kind of point of contact. And this is the work that we do really well. We're information professionals, and so we're not good at just giving information, but we believe in sharing resources and connecting people to them. So that's how we really feel that's our role in the community. Our second goal is equity, is really focused on service design, being accessible to all. And how can we work differently? So the library is changing a lot to respond to all the different changes in the community. And there is such a diversity of need in our region and at home in Nanaimo, presenting a real challenge for us from an equity perspective. And when we talk about, in context of today's conversation, the library provides services for all demographics. So we have seniors who are socially isolated. We offer a program with Altruza for homebound. We have a lot of different types of youth services, and teens. We have a lot of youth in our libraries, right? We have people who are living in campers and cars that come in and use our space and use our Wi-Fi. We have young families that come in and love our children's space and just let their kids run wild, get the resources. We have lots of different programs and services for them as well. We have programs for new immigrants. So there was recently a tour for newcomers, and I was talking to the service provider, and she was telling me that after they get housing, one of the first questions they ask is, where is a library and how I can get a library card? And I wouldn't know that if I didn't have that conversation with her, right? Like that wasn't something I was hearing. We were doing tours and lots of different services. A part of this goal is also digital readiness. I think it's important to know a lot of people can't afford data plans on their phones, and we hear that a lot. So they come into the library to use the Wi-Fi, as well as they don't have computers. So if you think of all the forms that one may need for government, housing, health, they come to the library and they use that, as well as our printing services. So we work with a lot of folks, we talk to people, as well as digital literacy, how to use a mouse. We offer a lot of one-on-one help. So that service alone is essential. Partnerships, we can't do it alone, and I hear that a lot today, right? And it's an opportunity to exchange ideas, and we want to learn from others, and we want to partner with traditional and non-traditional partners, particularly when it comes to offering services to the underserved. Our meeting rooms are busy, booked by various service groups. We have Nandu that uses our space once a week. And an example of a recent partnership is in April in Niagara Harbourfront, we hosted CBC Ideas. This was a timely panel discussion on housing affordability, focusing on Nanaimo, which is Mayor spoke on the panel, thank you. It was attended by over 100 people, and recently it was distributed nationally, so it's on YouTube, you can look at it. And this is what we're also very good at. We're a democratic institution. We're here for those important conversations, local conversations. I see ourselves as facilitators of sorts. Fostering safe and inclusive and collective services. We're a third space. We call ourselves the community living room. I can't really think of another space quite like us in the community. And particularly with the focus on being welcome and inclusive, as well as being safe, accessible, and resilient. So places for conversations and connection. Everyone is welcome during our open hours, during the heat, the cold, and the rain. We take safety and security concerns seriously, and we're constantly looking at employing new technologies and staff training and key partnerships. And some examples of the safe spaces is we had a $50,000 Island Health grant for Brave overdose detection sensors that were put in our high-risk branches. It detects when there's no motion and alerts staff. So it's used to prevent opioid poisoning, but also it saved us a lot of staff time, right? It was part of almost our schedule and checking the washrooms, because in our spaces, washrooms are generally where the most incidents take place. Again, public washrooms in the community. We have a security guards in our high-risk branches as well. And this is a relatively new expense for the library. Right? This is something we didn't have before. We have rules of conduct, guidance on expected behavior. Most libraries that like visits go without incident, yet they do happen, and when they do, we do take them seriously. I'd like to add too, when we talk about space, is relationships. We have people who come in our doors every day. We know their names. We know when they have good days. We know when they have bad days. And I'm constantly encouraging service providers to come into our space, because I think we're sharing a lot of the folks, right? So there's an opportunity there. Our goal 5 is really working within ourselves and centering our workplace culture. Some of the training that we provide to staff, critical incident stress management, workplace violence prevention and de-escalation, Naloxone administration, understanding addiction and mental first aid. We have a health and safety program, as well as an employee family assistant program that's available for staff 24/7. I can say again, 10 years ago when I worked in library, we had maybe 1 or 2 of these training programs, right? It's more dealing with difficult people, but now it's changed considerably. To close in 2023, there was a national report that came out by the Canadian Urban Institute and the Canadian Urban Library Council, which observed national challenges in the library sector, such as housing affordability, mental health, social isolation. And what the 3-year analysis came with is that Canada's public libraries play a crucial role in enabling governments to meet their obligations and strengthen the common good, and that we're offering critical supports in the community. And our expanded roles and mandate to respond to social vulnerability across the country and being that important community hub, it's a recommendation that federal and provincial governments relieve operational pressures and treat libraries as critical infrastructure. And public libraries are primarily funded through local governments, and they're strained, right? So there's constant kind of conversations of how we can work differently within this area. So lastly, I just want to say thank you so much for having me here today. I can talk library all day long and some of the programs we offer, and yeah, thank you.
Great, thank you so much. Councillor Manley.
Thank you, Chair, and thank you for the presentation. I'm curious about how the change has affected your staffing, because it's, you know, people go into study to be a librarian or archivist and not necessarily a social worker, but now they're finding, I think, that there's a bit more of a mix there, and I'm wondering how that affects staffing levels and retention, and just staffing in general in terms of morale and how people deal with that, you know, in particular with our library next door here.
Well, again, I'm going to go point, we've been doing this work for 89 years. We've seen a lot too, and a lot of folks that are working in the library come in with heart, right? But it has been hard on staff, and that's where just really looking at training, more conversations, and we've learned a lot from other public libraries and those in the sector of how to do better. And I think that's where we are right now, is where do we go from now in the change of the public library and maybe how we staff. Other public libraries, and particularly, I mean, maybe the more urban centers in Toronto, are looking at different ways to staff, keep their staffing models, but maybe different staffing roles and security. Yeah.
Right.
So we're still looking at that and how we, you know, change and shift.
And has it affected retention for staff, or?
We just had a staff day, and we have folks that have been at the library for 35 years to 30 years. I do, you know, like, and I think any place of work, we're really talking to folks when they enter into the library about what it's like working with the public, right? And we're seeing that in schools as well. So as a sector, we're doing work, and as like here locally, we do have lots of different conversations when folks come in. You know, it's we're more than just books in many, many ways, right? Yeah. Serving the public comes with its joys and different ways of interacting as well. Yeah.
Thanks.
Thank you.
Great, thank you. Mayor Krogh.
Thank you very much, Chair, and through you to the Speaker, thank you so much for the presentation. You mentioned 4 out of 10 Canadians have literacy issues, I think is the phrase you used, or something like that. Are the numbers getting worse, better? And if so, given I suspect your extensive reading on this, I'd love to hear it, and this is not really the appropriate venue, but I can't resist you're here. Any explanation for it? For the trend one way or the other, or has it been steady for the last decade or 2 or 3?
Well, I could do a presentation on literacy rate, and it's 4 out of 10 in adult and functional literacy, and it's declining in Canada. So there's many literacy, when you look at it, it's multi-layered. You know, the libraries invested in early literacy and school literacy and school readiness. It's home, schools, post-secondary, and I don't think anybody really has one answer why it's declining. But I do think that we can have lots of conversations about, even today, and how is literacy brought up in the conversation. And there's lots of even good statistics about, I think 1% in literacy and how much that would increase the GDP in Canada, and how that's not brought to the conversation. So I think there's a lot of people that are really interested and passionate about literacy. Our job, of course, as a public library working with others, is to bring that conversation higher. So we just recently finished an economic impact report about literacy, trying to look at literacy from many different lenses. Yeah.
And if I may, just to be clear, when you say it's declining, what you mean is it's going the wrong way when you say declining.
Yes,
it's not going the right way,
yeah.
just to be absolutely clear. Thank you.
Yes, it's not going the right way. Thank you.
Thank you. Councillor Hemmons.
Thank you, Chair. I just want to thank you for being here today. One of the things that I find so important about the libraries in this conversation is that you're not providing housing, you're not providing shelter, you're not providing food, you're not providing social services, but you are one of the very few places with an open door with a mandate to be free for everyone. That includes Wi-Fi, that includes washrooms, that includes services for helping to find jobs. So I just think the library continues to punch above its weight, and I want to thank you for that. I find your presentation quite gracious in the challenges that you're facing. And I just want to put a figure to Councillor Manley in terms of the security, because I'll just be blunt about it. So since 2020, pre-2020, the Vancouver Island Regional Library did not have a budget item for security. We're now edging close to $1 million. So Director Gillette is being very graceful here. It continues to be a challenge for the library, and the library, I think, continues to handle it very graciously. So thank you.
Thank you, Councillor Hemmons. And yeah, just my own observations, going down to the library downtown here with my young son on a rainy day, and I was actually quite surprised at how many folks were utilizing the library as like a warm space to be, and also when we speak about accessing further services because there's Wi-Fi there, utilizing it, and I think these are functions of a drop-in hub basically, that because I think that as a function that we probably could be investing more in is coming into the library, and I think that the library has been as Councillor Hemmons say taking this on in a gracious way, but I think that I think we do need to, just with our current resourcing levels, really need to clearly acknowledge that the libraries have been playing a function in our response to homelessness, and the discussion is how much of a role is right for given the mandate for that being on, and if it's not, how we can adjust our sales in terms of the services that we're providing in the community. And these are other discussions, but thank you for that, and I appreciate the presentation. I think that brings us to our next presentation, and that is John McCormick, Executive Director from the Nanaimo Systems Planning Organization.
Thank you, Chair, and thanks for inviting me to this conversation. I feel like I've seen you several times recently. It feels like I'm in my office in a way. So I really appreciate being a part of this conversation, and to listen to the comments of the people that we work with on a very regular basis. And I'm glad that we have the opportunity to share much of the work that's going on. That it's really quite dramatic, and really making a difference. I think my comments, given the nature of the challenge that we're faced with, I'm going to maybe come at it from a bit of a 10,000-foot level first, and then dive into some areas where we can be aspirational about where we might go to as a community. Because essentially we are dealing with what I think is the challenge of our time, is how to address housing. It becomes a question that affects every other aspect of our lives. So we'll just start maybe with the important question, which is how do we achieve functional literacy, or functional zero, sorry, literacy was what I did when I first started, and so you distracted me. Achieving functional zero when it comes to housing. And, this is something that we are looking at it way down the road and thinking, how do we get there from here? It's taken us a long time to get to this place. It's going to take us a long time to figure our way out of it. In many ways, I think there's going to be a national conversation. I'm hopeful that there is, that while we do these technocratic interventions, better data evidence-informed interventions, collaboration, integration of systems, which are obvious, that they alone are insufficient. And we've realized this, of course. As a community, we struggle, but the numbers on the point-in-time count keep rising, even as we try interventions. So ending homelessness, especially the broader forms of homelessness beyond rough sleeping rough, requires transformational change, really. This is the kind of conversation I think that Your Worship, you've talked about in terms of addressing some of the really intractable problems that we see on the streets every day. And that includes the housing and welfare systems, truly. So I think that said, that Nanaimo is in a pretty good place, as we can see, in terms of trying to do everything that we can as a community, drawing in as many resources as possible to try and move this along. Reminded about the point-in-time count that Christy spoke about. We are, and that Marina spoke about as well, that we're looking at a big jump from last year. And while that's a really good example of the great work that we're doing together, it's also really important that it's not just the number of people who are unhoused right now that keeps me up at night. It's the fact that we can multiply that by 10, and that's at least, and that's the number of people who are precariously housed. So to the comment earlier about that this really is a significant issue, and I'm not sure how we exactly come about understanding that, but I think in terms of our responsiveness as a community, it's been the response has been, if someone is challenged who's precariously housed, they sort of self-identify. We might be able to encourage that. I think this is an important way that we can start to address the needs of community members before they fall into homelessness. And I'll touch on that a little bit later. So the 4 ways that I want to approach the community need are additional homelessness drop-in hubs, including respite, additional rental supports, reactivating the programs to provide survival supplies, and additional emergency shelter, transitional, and supportive housing resources. Just on the emergency shelter side, we spoke about this the last time I think I was in a public meeting with council, that over the last 3 months alone, there were 550 times that community members were turned away from shelter spaces. It's a significant thing. I'm going to say that the data on that is not scrubbed to try and make sure that we're not double counting. There may be community members who went to one shelter and then went to another shelter. They got double counted, but the numbers are big. So that is really significant. In April alone, nearly 270 people were turned away. So these are big numbers, and we need really additional permanent year-round shelter beds. The number 237 is the number we've calculated, which is interesting. We've talked about the interest, how that sort of aligns too with some of the numbers of actual beds that are coming online. This is in addition to what we're going to be seeing over the next coming months in the partnership with BC Housing. So we're still going to be, we still have a fair ways to go. And the other interesting piece of that, of course, is we've got people falling into homelessness on a regular basis. They're not moving here to homelessness, they're falling into homelessness. Next slide. Christy also spoke about the loss of the outshop. We think it's a significant program. How it gets done, the kind of work that goes on there is really important. It's when someone comes in for survival supplies, it's often their first contact. This is really important because that's a first point of intervention. It acts then as a navigation center of sorts, and it also, given the fact that we're missing in need of a lot more shelter space, clearly this is really necessary for people, that they have camping supplies, survival supplies. They don't want to just sleep under a silver piece of something. They need some way to feel at least they've got some place to go to. The Outshop serviced about 1,000 people over the 4 years that it was in operation. So I would expect that there would continue to be, continues to be that kind of need. Got a lot of things going on here. I'm going to just leave this up here and speak just to a couple of items. Christy's talked about the really interesting work that she's doing on different layers of analysis that really works through a GIS system. And we're really interested too in how that worked in Abbotsford and how interestingly empowering it was for community agencies to provide outreach services. This is, we know that it was empowering to them, and it also was more efficient and effective. So if there's an opportunity for us to, as community agencies, to be able to work with the city to gain access to that, it seems to me, there's always the sort of devil in the details about these kinds of things. It would really be, I think, helpful for those community outreach workers to be able to work more effectively. The other piece that is interesting, and is the second to last on that list, so work with governments to adapt building codes. I struggle, this is a lightning rod kind of a topic, of course, and council actually, I think, did great work. Was it 2 Novembers ago when you, or Decembers ago when you passed the motion about Unitarian Church? Or Unitarian Shelter. That was really important, and it started to open up conversations about other buildings. We leave the people responsible for enforcing these things in a very difficult position if we ask them not to enforce them. In fact, we can't do so. But there's no other way to do it other than paramountcy. And if the province decides it doesn't want to do that for whatever reason, insurance reasons, I would presume, maybe. Then it leaves us in a very difficult predicament because the city is taking on the responsibility for that. There needs to be some discussion about some kind of a mechanism where, kind of like asking for a review of the play in a hockey game, that you could actually ask for some mechanism to be able to think about a particular circumstance that allows us to move along and it doesn't keep us sort of stuck in a difficult position. And I'll point to legislation that was actually passed in Wales in 2014 called the Housing Act, where they are required in the space of 56 days, and I'll just read it to you just so that we get this correct. Excuse me for a second while I find it. The Wales Housing Act 2014 has introduced a fundamental reform to homelessness legislation. This is an inclusive system designed to help everyone at risk rather than just those in priority groups. The duty to help anyone threatened with homelessness within the next 56 days. It's instructive for us here because we know now that where there's a willingness, there's a way. And what it did was it kind of opened up the possibilities of thinking about unused buildings and how you actually can address the challenges you're faced in a way that is organized, coordinated, and makes sense. I think it's something that's coming to a community near you at some point. It's certainly starting to become part of the discussion on a national level. So I wanted to flag it. I don't know if or when it'll ever come forward as a consideration, but I know that that council has at UBCM had kind of conversations like this, and I know that the province has had sort of exploratory work done in this regard. We keep sort of circling it, but we're not quite sure how to handle it. So maybe Nanaimo comes up with a proposal that we put forward that for consideration. And I know it's complicated because it goes to provincial level, and then there's national standards that are also part of this conversation. Okay. Let's see, preemptive actions. So we, are we going to take the new federal government at their word that they're actually going to come up with 500,000 homes a year? We should be prepared. for it. And I know that this is a tremendous city staff who will be prepared for that. I'm excited to be a part of those conversations for sure. We should, as I've touched on, really expand our proactive responses to housing precarity. Reach out to people, use social media, try and start to understand how many people are really struggling and what that might look like. We know it's certainly a lot less expensive to keep people housed than it is to let them fall into homelessness and then we respond to it. Again, as was mentioned in an earlier presentation, it takes about 10 days for someone's life to completely fall apart once they've been unhoused. They start to lose access to their stuff. The impact on their lives is dramatic. So it's very significant. And then I've said it before in front of council. We have a community where, how would I put this? Well, communities can be described by a barbecue. They're hot dogs and hamburgers communities, and we're a hot dog community, and other towns that are circular are hamburger communities. Having where you can actually have centralized services, and it works effectively for that community. Nanaimo's clearly not that. Our geographic profile just doesn't allow for it. So things like OPSs that are where we've got one OPS means that everyone's sort of drawn into a section of the city. The fact there's one hub doesn't really address the needs of community members up and down the community. So this kind of less centralized of servicing, which means multiplicities of services, is really important. We did, when we initially talked about the drop-in hub, talk about more than one, and we know that that's necessary. I think that the OPS conversation, as difficult as it is right now, does require revisiting. Can we, have more of those and smaller footprints as a result, so that community members who are in need of an OPS are not drawn into one site, so they don't maybe have to leave their building. Maybe they can be in their building and still have a supervised site where they can use. Important. So, and then finally, I just wanted to talk about sort of taking the initiative locally. I think that and we talked about this as well the other day, is that I think that there's really an opportunity for us to be proactive, to identify a plan for what I call non-market housing. It's been discussed here as supportive housing. That allows us, provides the grid around which a plural of work can happen, that draws in our community partners, all of us, into understanding how we can bring together and move towards developing housing, not just, and I shouldn't use the word just, not shelters alone. That it's really important that we're also having a staged process for people to be able to move through this process to actually having long-term housing. From the SPO's perspective, that's in addition to the kind of housing that we might be seeing coming online in an iterative way. So really taking a more proactive approach to that. And then finally, just to address inflows. We really need to address the inflow into homelessness. It's one thing for us to deal with 1,000 people. It's another thing to have this constant pressure that's affecting us. One of the other considerations in that regard that I think holds us back, perhaps in some ways, is that we maybe have a fear, that if we have great services here to address homelessness, that it'll attract people to Nanaimo, and it'll just overwhelm us more. I think that the reason we've been having discussions with our colleagues in other communities on Vancouver Island, because what happens in Cowichan or what happens in Campbell River, Oceanside, Parksville, these are often community members we've seen as well, because there's a bit of a flow that happens around Vancouver Island. So how we can work as a collective of communities, as a regional effort, not just city by city effort, is really quite empowering. And it also will help us to be able to provide more services in each of these areas, in each of these places, geographic locations, in a way that doesn't sort of mean that people are chasing housing services. So with that, I'll end my presentation. Thank you very much.
Thank you very much, John. Councilor Perino.
Thank you, Chair. And question, actually, I've got a couple of questions, if you don't mind. First question is, what you just talked about, John, as far as, because I've heard that over and over again as well, that they're all coming to Nanaimo because we have services, right? And so if we didn't have all these services, they would go somewhere else. And you're saying that is not true, or are you saying that there is some of this going back and forth between communities, and so we need to be maybe working better with our regional partners? Or just explain that for me.
Yeah, if we could find a community that hasn't said that, you know, somehow there's an illogic.
They're coming in on the ferry.
Everyone's coming across here. Vancouver Island's probably the hardest place to come to try and find housing. I mean, it's a long way to come for starters. There's a natural barrier there.
Yes.
But every community, you know, that we talk to says, you know, has some story about someone coming from away. By the way, we live in a country where you're freely able to travel between communities, but you know, so so there's, you know, something about that as well. I think it's a fear. I think but notwithstanding that, if we're competing against our neighboring communities for funding or for opportunities, that's sort of counterproductive, because we really are producing, in a way, creating the circumstances on all of Vancouver Island that's leading to homelessness. It's a weird fact that as we become wealthier, there are more people who are unhoused. Isn't that odd?
Yeah.
Yeah. We know why, of course, that it just becomes more expensive. But people who have, you know, who are living here for 50 years, renters who are suddenly homeless, you know, this is one of those significant cohorts, people who just can't find housing. You know, the list is long of those who, through really no fault other than just not being economically advantaged, are being unhoused.
Yeah. And my other question was a comment that you made about, it was a couple of slides back, work with governments to adapt building codes for emergency shelter spaces or rapid rehousing. And my concern is that we have a lot of empty buildings in town. I wish that we could somehow adapt those buildings to emergency shelters, if we could, all over the city, so that it's not in one area, but spread out more. However, when you own those buildings, you have a choice as to whether or not you want to do that, and that's simply not happening. But my concern is that we need to make sure that the building code is enough, that people are not moving into a situation that could be very dangerous.
Yep.
You know, that's my concern. The Unitarian was a unique situation, but you know, we need to make sure the buildings are safe, because when vulnerable people are living in them, they need to be enough without being over the top. And I just wondered if you could address that.
Yeah, thank you for that question, because it really is a question of balancing risk. And
yes.
There's a, you know, we have building codes that are updated on a regular basis. I think the most recent update was very recent. And yet people live in buildings that don't meet those criteria, and yet they're safe.
Yeah.
So so there's a point at which when people are left outside because you're not putting them under shelter.
Yes.
But there's where we have to think about, you know, evaluating the relative risk of leaving them outside versus sheltering them. And not everyone is going to be a mortal danger or risk if put in under shelter. There are community members who we have to be careful with doing so, but most people are not like that. So what we don't have is a mechanism to do that. We don't have any mechanism to evaluate the relative risk of doing so. And I'll give you an analogous circumstance. I was at the scene of an accident once, and the vehicle was not in very good shape, and the person needed to get out of that vehicle fast. It was potential for it to blow up, and I dragged them out of the vehicle and got them away from the vehicle. Had they become a paraplegic because of my actions, I would not necessarily have been held responsible.
That's
for
right.
that. We can check with Mayor Krog about whether that's true or not. But the circumstance of the Good Samaritan rule does apply, I think, when we're talking about housing.
Good point.
We're leaving people outside saying it's, you know, we don't have, this building doesn't meet building code for, you know, occupancy, overnight use, doesn't meet zoning, and yet we're leaving them outside saying it's not safe. And it's like, damn, it's not safe for them to be outside.
That's
You know,
right.
there it's 2 degrees weather. We can't institute emergency extreme weather responses. We're leaving people outside, and it's not safe for them.
Excellent. Thank you so much. Thank you.
Great, thank you. Councillor Manley.
Thank you, Chair. A couple of points and then a question. One is that the Unitarian shelter is permanently non-conforming. And that is my understanding. I never had a conversation with the fire department about it, but it doesn't have sprinklers in it. And so, you know, people are awake all night long watching people sleep. I tried to, you know, pass it off as a meditation class that people were meditating really hard and fell asleep, and then eventually they got woken up in the morning by the people that were running the class. But it, you know, it's permanently non-conforming because it doesn't meet the building code. It never will. And so you know, we need to be able to have situations like that, because there's somebody there on fire watch all night long, and they're awake. In terms of, like, if you build it with, they will come. Going to Federation of Canadian Municipalities, I talked to all kinds of people from across the country. I was talking to councillors in northern Alberta who said that people were showing up in their community with mental health and addiction challenges who were homeless that they'd never seen before. Well, that doesn't mean that they weren't from the area. They might have been living in another part of the region, but this is an issue that's happening right across the country. You know, I talked to councillors in Ontario, Alberta, everywhere. So it's not like if we do something in Nanaimo that we're going to be attracting homeless people to come here. And it's not like Ralph Klein's putting them on a bus anymore because the Olympics are here and gone. That did happen, but you know, we can't have that process of provinces trying to ship people off for those kind of reasons. I'm old enough to remember when the first food banks opened up, and it was a temporary measure to deal with hunger, a temporary measure. And now food banks are everywhere, in every community, large and small, and we should be doing and pressuring the government to do what the French government has done, and that is to ban the waste of food. So in grocery stores of a certain size in France, they're not allowed to throw food out. It has to go into a system where it feeds people who are living in poverty. And we need a similar kind of system around affordable housing. The idea that we are going to increase shelter beds by 200 shelter beds in this community, I find is appalling and shocking, that we would have 300 people flowing out onto our streets every morning in all kinds of weather because we need shelter beds for 300 people. So one of the things I actually wanted to ask you about the last time you presented here, because I think it's a really good, interesting idea, is working with some of the community organizations, the faith-based organizations that own land that is underutilized, and working on projects like Brecon United did, where they took a church that was underutilized and a great big parking space. Now they have a building and they have their space for worship and gathering and community space. And you had mentioned, you know, kind of building a team out. So I'm curious about how that's going, because I know, you know, just talking to people in faith-based organizations, that can be daunting. The idea, like, you're going to develop a property, it's like well beyond their level of skill and expertise, and it's an idea that can get shelved quickly. So I'm curious about the kind of team that you're building and who might be involved, and how that's going.
Thanks. Thank you for that question. It is. I know when I was an executive director at John Howard Society, and had some familiarity with this, it was still difficult. And I had a board chair who was very good at doing building work, and it was still difficult because you're trying to put the financing together, and you're trying to do the planning, and you're trying to figure things out, and you're busy trying to run an organization, and board members are volunteers, and so you know how volunteers are, like to travel, they like to do things. So it's hard, and so the nub of the idea is very simple. With those organizations that are interested and willing, the SPOs will provide that sort of Energizer Bunny sort of component to it to keep things moving along, to be their gophers, to be the ones who work to make sure that the energy doesn't dissipate over time, which is really what happens. People go from the dream to sputtering. They get an idea, but then it sputters. So how do you go from dream to keys is really the idea. So we're working with a few organizations now, and it's an iterative process. I think I struggled with it last time I talked about it as well. But I think this is part of what a 10-year plan is about, is let's have a very organized, coordinated plan. We start to kind of line up those organizations like planes coming into the airport. We start planning ahead. We work with our private sector partners as well as with the community agencies and with the landowner community organizations to move this along in a coordinated way, which also allows us to address need and needs of the community, and also the wants and needs of those community landowners, who will obviously have something to say about that. We've had initial discussions, more than initial discussions, with Collier project leaders about this, and they're happy to help us sort of put the initial stuff on that. And then we'll pull together a community of partners, some of whom would be in this room, are in this room, because I think this is the essence of a collaborative effort, isn't it? To really bring all of the capacity together towards achieving something over the long haul. So it is, as I said, the grid around which that pearl can form, and it provides us direction and guidance and something to work towards that we can all coalesce around. So I think it's one of the things that we can do that adds to the already considerable amount of work that's going on. This is in addition to as well. So, and it provides a way for the community that wants to be a part of this to actually contribute and participate in this. And I'm firmly fixed on this plan being associated with non-market housing. I think affordable housing that sort of starts to move towards private market housing is an easier development cycle for sure, because there's funding that's going to be very obviously in place for that. This non-market housing is a trickier one, but I'm up for the challenge, frankly.
Yeah, when I talk about affordable housing, that's what I mean, non-market, cooperative. Yeah. And I think it's a great move to be making, and in terms of like preparing this community, getting a number of proposals in front of BC Housing the next time they open up their process for grants to be prepared for the Housing Acceleration Fund from the federal government, to have as many proposals as we can going forward. It actually just speaks to the need and the desire and the willingness on behalf of the community to do something proactive. So, thank you.
Thank you. Councillor Hemmons.
Thank you, Chair. Thank you, Mr. McCormick. Two quick questions for you. The first is, can you remind me of the funding with the Outshop program? How did we lose that? Where did it go?
It was Reaching Home funded, and there was a decision made by the CAB to fund other programs. So that's my understanding. And United Way's here, so you can correct me if I'm wrong, but that's correct?
Okay. So we didn't lose the funding. The community of service providers who oversee the funding, the community chose to put it elsewhere.
Right.
Okay. I was just curious about that fronting of that program, because as we heard, the shower program, for instance, has seen a volume increase of 400% in the last 5 years. So I'm curious about the programs that we're choosing to surface and say we need these back.
Yeah.
My second question for you, and this goes back to Marina's comment about capitalizing on our investment and coordinating our services. You're the first executive director of the SPO. The SPO was created with this big, grand idea of we're going to coordinate all the service providers in this kind of space. Can you just give a general rundown of where the SPO is in terms of that collaboration? And I think today's meeting is one kind of demonstration of that, but if you could just share a little bit about how you are working, to capitalize on that investment and coordinate everyone in the room today towards that end goal.
Right. When the SPO was set up, the clarity of its work was identified in the bylaws of the organization, which is to convene, collaborate, facilitate, provide research. And it really importantly in there was system gaps in that conversation. So rather than replicate or supersede some of the conversations that were already happening, for example, at the Community Advisory Board or other strategic group meetings, things that come along like the strategic working group that BC Housing's Heart and Hearth program is participating in, and becoming kind of the public voice for housing and homelessness in Nanaimo, which would require us to take on quite a sizable communications function. We focused on working with our partners and stakeholders and to look for gaps in the way we were operating that we could contribute to the overall success of the program. So operating in a very much more consultative capacity, collaborative capacity, rather than in a leading the band capacity. I never want to take responsibility or take the credit for anything that happens in the community. I want us to work as part of the team that helps to achieve success. So, we've got a small team, and we try and do everything we can on a daily basis to try and contribute to the greater good of the effort. And there's lots of moving parts. There's community agencies that are doing great work, and there are places where there's a lot of collaboration, frankly, that happens on a daily basis. Just in the conversation that we're having about a 10-year plan, I was in conversations with 3 organizations today and tomorrow and the next day related specifically to that. And then we worked with, for example, SFN on the point in time count, along with the city and with United Way. These are collaborations that happen that are just part and parcel of the daily work that we're doing. And I think that we sometimes think, well, if it's not a sort of convened group of a large group, then that's not collaboration. But that's actually, the most of the collaboration happens when you're working on a day-to-day basis. The sort of whiz-bang stuff happens when you have a big group meeting. But often the most effective work happens because you can get targeted in on specific projects. And so I think that's how we have operated. And rather than sort of try and challenge other meetings or replicate other meetings, is maybe the better way to describe it, we participate in existing functions, meetings, activities, and work with our partners to try and address the challenges that they're facing that help move us all along the continuum of success.
Thank you.
Thank you.
Great. I'm not seeing any other questions. I appreciate the presentation. And we are nearing the end of our agenda, actually. We're into question period next, but before we move on, I just wanted to say a big thank you for everybody who came and presented, and for staff putting this together. It is a team effort addressing this challenge that we're facing, and it's been really heartening to hear the amount of coordination amongst the different agencies and groups and the investment in the community on this. And I think that, in the last 4 or 5 years, I've definitely noticed a change in tone and how we're going forward. And I think, we're starting to really hit our stride. And that's what the community needs. So thank you for everybody and your efforts. And it's great to have everybody together sharing information here at the city. So have a good rest of your day, and thank you. Oh, and we do, so we'll move into question period here now, and we do have one question from Sydney Robertson from the South End Community Association.
Hello, thank you. I also want to just say how much I appreciate everyone who's here today and whoever pulled this together. I'm kind of looking at Christy Wood, but I'm not certain who was all involved in that. I really appreciate it. I have two questions because I realized as I was listening to people that there's quite a wealth of knowledge in this room right now, so I have to take advantage of that. My first question is, I just wonder, well, let me just preface it by saying I think that everyone here is probably aware of the concentration of supportive housing and services that we're living in the South End and the challenges with that. Is anyone aware of a study or any other work that tells us, how big a community does it take to absorb successfully this many people, with these kinds of needs? If anyone can point me to something, I'd be really interested. And then on a related question, are there any examples out there of other places? We know that lots of places are dealing with this kind of thing too. Who's doing it successfully on this kind of scale? Where can we look to a place where it's working, where people are getting successfully integrated? We've had some interesting discussions recently in our board meetings especially. We're trying to address the challenges, look for better ideas for the future. At the same time, we don't want to other people. We have people in our community, and we just want to know how to do it better.
Thank you very much for the question. I think this issue of concentration of services is something that has been on awareness. I live in the South End, Councillor Hemmons as well, and you do see the impacts on it, and it can be very difficult on the neighborhoods. And I'd open up for anybody here actually that if they wanted to comment on that in terms of how to properly structure the infrastructure and services to address this without burdening one particular area. So, John, Ms. McCormick?
Yeah, just in terms of this, you ask, are there any other communities that have successfully addressed this? Given the current state of policy and funding, the communities that have been successful at housing people are places that have relatively high vacancy rates. So it's not, the challenge is often the lack of a place to put someone rather than the challenge of trying to house someone, or keep someone housed. So, places like Medicine Hat and St. John's, Newfoundland, had good success early on. They could within 24 hours house someone quite easily because they had no growth. A place like St. John's now is struggling because their vacancy rate has dropped considerably. So in my presentation, when I talked about us talking about the need for transformational changes to the way we think about these things, that's what's partly is what is needed, that we need to rethink this as a country, not just as an individual community, that we can do a lot of things here, and Nanaimo is growing in wealth and capacity. So there are perhaps some doors that might open to us in our capacity to do so, and Vancouver Island in general is seeing an influx of great wealth from around the world, not just Canadian wealth. So, so that's one aspect of it, but there is I think there's a broader conversation that's starting to happen about the fact that we can't just keep going the way we've been going and think that it's going to solve it. I think it's not the definition of insanity to just keep doing the same thing over and over again and expecting different outcomes.
Yeah, thank you.
Thanks. Anybody else wanted to speak to that? I see Councillor Hemmons.
Thank you. I just want to, I think Ms. Robertson's aware that there's a motion on the books to have city plan, our review of city plan to include a draft policy about concentration of services. And these questions you ask about the population required to successfully absorb large supportive housing units, I would hope would be answered in that report that accompanies the bylaw. and as well as examples of places that are doing it well. So I think it's a to be continued. Our eyes are on it. Thank you for asking the questions.
I was just going to
Thank you.
respond to Sydney, because I'm up for the challenge. So I think for me, what is really important, how do we gain momentum to end homelessness? And I wrote something down as people were talking, and I wanted Councillor Armstrong isn't here. I do agree with her. We do need some placements in housing, BC housing, for those that are in recovery, because I've had to turn some of the people that we could house in those places, they had to turn it down because their recovery would be at risk if they said yes to the housing. So that is something that I do hear, and I've had conversations with Councillor Armstrong about that. And then I thought about, like, how could it be successful? And how could it be successful? So in our nation, with partnership with the City of Nanaimo, we have 12 transitional units. In that is a wraparound service for the tenants that are there, or the people that are housed there. And it's what you're building in is expectations. How are you expected to conduct yourself? How do you behave? And what are the expectations? And, you know, we were really fortunate to hire an expert here, Matthew Stevens, and he built in those expectations with the tenants in our 12 units. And I want to say it's been successful. And I know, you know, Dale, you came to our chief and council and said, how can we do this? Well, you know what? You know what the chief said to me? He said, Marina, how are we going to do this? I don't want to be like Labio Road, or what's the one just up here? Terminal. I don't want to build a shelter where it's going to create harm, or it's going to create an influx of mental health and substance use. And I said, I agree. So with that, we agreed at the health center to provide wraparound care. So I really believe that wraparound care, and I don't mean just wraparound care, I mean from the basic to the mental health to the substance use. And I think also what we need in the city, because of the complexity, we need more psychiatrists. We need more psychiatrists at our emergency. And I think for me, what I think is that, you know, for stabilization and wait time, there's so much. And so you bring that wraparound care, and you bring more CAR 54s to respond. And I know this sounds like a lot of money, but how do we put this together? How do we be successful? Because how are we going to make a difference one homeless person at a time? And I can honestly say, I heard from somebody from Edmonton, who was our first tenant in our building. She now has a job. She's living, she had to move out of Nanaimo because it wasn't affordable to live here. She has her child returned to her. So that's success. So, you know, I want to go to coffee with my friend up there from the South End, who's been wanting me to come and meet with them. And I'm taking her on that challenge. So thank you.
Thank you so much. You know, one thing I did hear also from the Island Health presentation was just on access to different healthcare services and being able to have that a bit more distributed. And I do look, you know, in the South End, there's, you know, very specific location in Nanaimo where you can access these certain services, and I think that's something that we can also look at as well. Yeah, I thank you. I'm not seeing any other Oh, yeah, I'm not seeing any other questions, so thank you, everybody, and we'll entertain a motion to adjourn. Moved by Councillor Eastmere, seconded by Councillor Perino. All in favor? Motion carried.